I'll still call you.
Okay. Yeah.
Okay.
Talking back here up front.
Just go up front. Yeah.
Hello, everyone. I'm here to do a wait, not a toast. My name is Steve Odorizio. I'm one of the county commissioners here in Adams County. There are 5 county commissioners. We're all elected at large. We come from 5 different districts. What that means is that we all have some geographic diversity within the county on our board, but we're all equally accountable to everyone. Why do I start that way? Because our goal is to try to build regional cooperation across all of Adams County, both inside and outside. I'm joined today with Eva Henry. You can wave.
Oh, wave. Hi.
And I'm really proud to introduce to many of you for the very first time, Noel Bernal. Noel, if you want to come up here, please. Noel is our new county manager to Adams County. Let's welcome him. I hand the virtual mic to him in just a second, but we want to thank everyone for coming out. Thank you for coming to the Human Services Center. This is where a lot of your constituents, a lot of your stakeholders, a lot of your customers come for help. It makes sense that we're meeting here because what we are trying to do is save lives, save families, and help people who need it. So thank you all. Some of you are from cities, some of you are from other government agencies, and some of you are just general partners that we need desperately to partner with to address this opioid and overdose epidemic. So thank you all for coming. That's all. What I'd like to do before I hand it to Noel is, do we have elected officials? Can you all please stand real quick? And then I'm going to point to you and you say your name and your position, where you're from.
I'm Peter Padilla. I'm on the City Council for Brighton.
Doris Peterson, Mayor Pro Tem, Devil Heights.
Aaron Garcia, council member, City of Florida.
All right, and then Eva Henry.
Oh, just introduce me.
Yeah.
Eva Henry, County Commissioner. And I'm here to maintain Steve under control.
And that's my cue. I'm going to go sit down. Thank you all very much. Noel?
Commissioner, thank you. And both commissioners maintain me, along with 3 more. So, hey, how's that? Good afternoon. Thank you for having me. Thank you for the invitation, commissioners. This week wraps up my first week with Adams County, and I am getting cross-eyed from all these budget meetings. So it's good to see people and not numbers today for a bit. Staff was gracious to allow me to leave the cubicle that they prepared for me to get all of their budget items funded on my first week. But thank you so much. Just a bit about me. I am coming to you all from Texas, where I have spent all my career in city government, particularly in city management, ranging from small city to the largest community that I was at, formerly Brownsville, which is a border city, almost 200,000 population, home to SpaceX and Elon and all that fun stuff. But no different than Adams, and no different than your communities that are here represented in terms of we also have issues. And I think one of the commonalities of whether it's Colorado, whether it's Adams, or any other respective community is how do you solve issues that are very difficult to solve, that are better solved many times at the community level, at the regional level, and that are multidisciplinary in nature, where we don't have all the answers, where we need partners, where we need help, where we need to understand where the county in its unique role and platform as a convener can be an asset and a facilitator to finding solutions that can work. And my commitment is to come in today. I understand that this is still a relatively new council and group, is to come in and lend support, to learn and work alongside all of you for the county to fulfill the role of being that convener, that enabler, to where we can come up with viable solutions. It's difficult. Sometimes what happens is as you're trying to get that traction, you can get stuck with looking for perfect answers, but many times those answers don't exist. Many times it just takes us taking action and getting started. And my hope is that we can get there. We can get there, that we can learn, that we can borrow from best practices. And if we need to flex and pivot at times, that we do that too. And that we provide that leadership to where we are all understanding as to what it takes and what we're getting into. Because this is a journey and this is a challenge. And certainly for us locally, you all bear a lot of that data and a lot of those stories of the people who this is impacting And that's what makes it real. Life safety is one of the most fundamental things that we do, regardless of who we are as an organization. So this is right smack within that area of where we need to step in and step up to provide support and leadership and solutions. Thank you so much. I look forward to visiting with you respectively as I spend more time out in the community. But for now, I'll sit down and let us continue. So thank you so much.
Thank you. Hello, everybody. My name is Jody Nowicki. I am the Senior Director of Stakeholder Engagement with the Rocky Mountain Partnership. We'll talk a little bit more about who we are as an organization in a minute, but we're really excited to be here facilitating you all for the second, and I would say this is almost like the kickoff because we're actually in person and not sitting on Zoom, Adams County Opioid Regional Council meeting. So real quick, high level, what we're gonna hope to accomplish today. I know it's a pretty big agenda, but we'll walk through our timeline and hopefully take some of that anxiety off everybody. We're gonna provide a high level overview of what this effort is. I know some of you have heard a lot about this, but just set some context for why we're all here today and what this council is really charged with accomplishing. Then we really hope to gain consensus on an initial measurable target for the next 2 years to address the opioid crisis. So we'll go through a lot of data, understand what our current state is, and see what does this group want to see change in the next 2 years, knowing that this effort is of course going to continue on well beyond the next 2 years. We'll then develop a draft plan for how funds will be allocated. Some of you have heard about the 2-year plan that this group needs to submit to the Attorney General's office before we can start giving out dollars. It's a lot less scary than it sounds like, so I'll walk you through what that looks like. And then just some final structure and governance. We have had some nominations for chair and vice chair for our voting members that I'll introduce in just a moment. Also, hopefully reach consensus on the name of this group. We have one option, but if anybody has any brilliant, innovative, creative ideas, extra credit, and we'll be asking for those ideas later. And then also, for those of you who were on Zoom at the end of June, the group decided that it would be a good opportunity to develop a council statement on opioid addiction. And so we have a draft of that statement that we'll be able to get additional input on and reach consensus on as well. Oh, that's not gonna work. Hold on. My clicker. On your tables, you have this agenda, so it'll go away in a minute, but you still have it. You also have a QR code to an interactive data scorecard that we're going to talk a lot about. We have computers around the room for you to use it, but if you wanna pull that up on your phones, please feel free to do so. We are going to dig into why we're here. We'll have a coffee break around 1:40. There's lots of water, tea, and coffee that will be coming in. If you need anything, if you need to take a break or take a phone call, please feel free to do what you need to do. Just a few logistics before we get started. So I think many of you already know this, but all regional councils across the state must follow the Colorado Sunshine Law. So this meeting is open to the public. It has been posted. We do all of that on the Rocky Mountain Partnership website. We are also live streaming today. So we are recording and streaming. This is going to be an interactive meeting, so the folks that are joining us virtually will just be listening in. And Diana Bustillos from our team is managing that for those folks to send any questions to her, but we'll have minutes and the recording posted after the meeting. I also want to note that Diana from our team is going to be walking around taking pictures, so if anybody does not want to be included on social media, she just actually stepped out, but you can grab her as she's taking pictures and let her know if you're uncomfortable with that. Wi-Fi access is open for ADCO Gov Wi-Fi. If you have issues logging on, please let one of our Backbone team members know who are at the table in the back. Bathrooms are just outside of here to the right. We also have a parking lot, so if there's things that come up that maybe aren't falling into the focus for today's meeting but are important, let us know and we'll capture them so that we make sure that we can come back to that. Myself and Ashley Ettinger from the Backbone team are going to be facilitating and scribing for you today. So all of those action commitments, key decisions that are made, we'll be writing those up here at the front. And again, thank you to Adams County government for hosting us in this space. We're excited to be back in person. So, roles, I mentioned Rocky Mountain Partnership. We are the convener and facilitator of this group. We'll talk a little bit about what we do for this effort, but we have been contracted by the county to facilitate this regional council, and we're very honored to do so. We have several of our regional council voting members in the room today, and they each have paddles. There is going to be a few junctures where we're going to need an official consensus from them. So we will be getting that informed, of course, by this entire group. And we are so excited to welcome all of you content experts, community members with lived experience, other local government officials. There has been so much excitement and interest in being engaged in this effort across the entire county. So we're excited to have an open door policy. If you want to be part of this effort, we're glad you're here. I'm going to invite Councilmember Padilla up to speak a little bit about norms for our time today.
Sure, and I'm actually going to stand a little bit farther away from the front of the room because I didn't memorize the list and I'm not going to read it to you. But what I really want to make sure that we're working with today is we have audiences or people participating in this audience from a number of different constituencies. And we want to make sure that we're hearing from each of those. So elected official professionals in the area, people with lived experience, but we have a lot of work that we want to do. So we want to respect time. We want to make sure that as you speak to the entire group, you're conscious of and respectful of that time. We don't need to hear the entirety of the story. We don't necessarily need to hear a repeat of exactly the same experience. So we can nod in agreement, we can give thumbs up, but we don't necessarily need to repeat the same material for everybody. Again, that parking lot, if there are things that come up that really are important to discuss, but maybe not directly on the agenda of what we need to get done in the next 3 hours or so, then let's put that into the parking lot and move forward. And let's assume, again, that everybody is here for a similar purpose, the same purpose. We have money to be dealt with, we have decisions to be made, we have policies to align on. Let's assume that everybody in the room is here for that purpose and has the best of intentions and best of plans there. And then, of course, the idea that we love to talk. You get elected officials here, we're going to find an opportunity to talk. You have counselors here who don't get to see each other very often. You're going to want to have the conversations that can move slightly to the left and into a different space. And let's focus here, because again, it's Friday afternoon, and for the folks who are having to work for this Friday afternoon, I also want to make sure that we're not necessarily pushing this longer than it needs to go for those people who have a chance to spend a little bit of time on a summer afternoon with their families. So have we missed any points that people want to consider as norms for this group going forward? Are there things that we would like to add? Or are there things up there that you might have a disagreement with and wish to discuss further? Excellent.
All right.
Back to you.
Thank you. All right, I'm excited to now hear from all of you and for you to hear from each other so we know who is in the room today. So what we're gonna do is we're gonna kind of go round with the tables, thinking maybe we'll start on this end and guide throughout the room. But I'd love for you to share your name, the organization that you're with, the role that you hold within that organization, and if you feel comfortable sharing, why is this important to you? Why are you here today? I am gonna pick on Glenn, one of our voting members.
Good morning, or good afternoon. Glenn Robinson. I'm with Adams County Human Services. I work in this building. My role is I'm one of the deputy directors, and this is important to me because it has hit so many parts of our community, but also so many parts of the country. So I think that we can really make some headway with the work that we can do today.
Good afternoon, my name is Clinton Watley. I work at Tri-County Health Department. I'm the program coordinator of the harm reduction and HIV prevention program, the health department, and addressing why is it important to me. I think just, on a daily basis, kind of visiting and working with these folks who are definitely struggling with this crisis because of opioids. Definitely hits home, seeing our unhoused communities that are just struggling on a daily basis and really trying to provide them with just options, any option, because I feel like they don't have a lot. So Thank you. Nice to meet you.
I'm gonna hop back to this table.
My name is Nicole Costa. I'm the owner of Heart Counseling Center in Fording. And this is important to me in many ways. I think the biggest thing that I was excited about to find some solutions is my dad passed in 2018 from an overdose due to opiates. And so it's very important to openly speak about it and advocate for it and find solutions to it.
Thank you. You've heard that I'm Peter Padilla, but the reason that I think this is important to this particular regional council is that Adams County, while we have many things in common across the county, is also two very distinct identities. Our more first-tier suburban community and then a rather large swath of rural community where these issues have hit home very deeply. And I want to make sure that we are looking for the needs and solutions that assist us.
I'm Lori Bailey, I serve as the Director of Student Engagement Initiatives for the Adams County Five-Star School District. Here because it's important to do what we can and provide interventions for our students and our families.
Hi everyone, I'm Levon Hupfer. I'm named after the Elton John song, so if you need to know how to say my name. I'm the Director of Diversion, Health, and Legislation for the elected District Attorney, Brian Mason, and in that role, I serve policy, legislation, but I'm also a licensed addiction counselor, and I've spent 20 years serving people who have been battling this disease. We have argued a lot over the years about what this is, and so I'm happy that we finally realized this is a disease and we have to treat it differently, because as a treatment provider also, we've really failed at treating individuals who battle addiction. So really happy to see you here and lots of friends and friendly faces, so thanks.
I'm Lisa Keenan. I am the Behavioral Health Program Manager for the University of Colorado Health. I'm here professionally representing our hospitals and from our emergency departments to our inpatient units. We have so much of our care. And so much of our outcomes come down to mental wellness and addictions. From a personal standpoint, I've been a social worker for over 20 years. I'm a family member. And I have 3 teenage boys, so I'm a parent too in this space. And there's nothing more frightening than we're facing now with what we're seeing on the streets. And so much of what we're dealing with is preventable. So that's my place today.
Thank you again. I'm Doris Peterson, Mayor Pro Tem in Federal Heights. I am here because my daughter died of an accidental overdose just last year. She took a street drug that was laced with fentanyl, and the fentanyl stopped her heart. So if I can prevent one person from doing this, I will do it.
This table.
Afternoon, my name is Chris Dow. I'm a counselor with Creative Treatment Options, a treatment agency. We have offices in Commerce City, Arvada, and Lakewood. This is important to me, not only through lived experience and everybody that has been around for me, been around in my life for many years, dying of this use of these drugs, but also treating it and being on the front line of treating opioid addiction over the last handful of years, and just watching our clients unfortunately die one after another is something that needs to be addressed and continually addressed in a better, more effective way. And again, like someone else said earlier, we can always improve upon what we've done in the past and continue to make strides to prevent just one more, if not a handful more of deaths.
I'm Devin Meisner. I'm the Assistant Clinical Director of Creative Treatment Options, as well as the TV coordinator. And I think it's important to address this crisis because it just keeps growing and growing. And to be frank, I'm just really tired of clients dying.
I'm Dre Smith, I'm the clinic director for Creative Treatment Options. I am not named after anyone special.
Come on, Joyce.
I'm very envious of that. But I probably could sing that song along with it.
We'll see later.
Okay. I've been the clinic director at Creative Treatment Options since the year 2000. We've been open for 25 years. I love these clients more than I can say. They walk in with so much stigma and so much trauma, and they just need somebody to embrace their life and help them live through it. And I'm here because this work is important to me, and it's been my dedication in my life.
Hi, my name is Alex Castro-Croy. I am the clinical director of Life Recovery Centers in Northland and in Denver. I am the owner and director of the agency. Why is this important to me? Prior to jumping the fence into treatment, I was the drug court probation officer for Denver Juvenile Probation for 11 years. And I saw a lot of intergenerational trauma that was not transformed, was transferred onto the kids. And so then they adopted a lot of the substance use behaviors of their parents or coping mechanisms, adaptive coping mechanisms. And so knowing that I'm bilingual, part of the GLBT, immigrant Latino, I fit a lot of the need within the community, and I decided to leave the criminal justice field and jump into treatment. And so and on a professional level, as a treatment provider, I have too many juveniles dying. Right now, there is no inpatient dual diagnosis facility that's covered through Medicaid in the state of Colorado. And I'm tired of being complaining. I'm ready to step in and do what we gotta do to make something happen. So that's why we're here.
Go to the back table. You've introduced most people at the table, but not everybody.
Yeah, that'd be.
Well, we're not, but I'm mad. I'm here because it's important to all of our stakeholders, and this is our community, and that's why I exist, why we exist to serve our community.
Commissioner Eva Henry and passion to serve our community. This disease has been underfunded way too long. It's here because of the simple fact that it was a breed of a certain family that had put this drug on the streets, continue to put a drug on the streets. Too many of us, I think every single person in this room has been touched. Family members, friends, and it's been going on way too long. And we've got to put the funding behind the talk. I mean, that's just where it's at. We've got to put the funding behind the talk. People can't afford the treatment, and that's where it's at. I've got family members that had addictions but couldn't afford the treatment. They knew that they had the addiction, and they wanted to go have help, but they couldn't afford the treatment in the treatment facilities, and they didn't have anywhere to go. So hopefully we can find the solution and be able to get these people the help that they need, and the care that they need, and the support that they need.
Hi, I'm Kelly Terrell. I'm with Mile High Behavioral Healthcare, which includes the Aspen Center for Women here in Westminster, which is a residential program for pregnant and postpartum women.
Awesome.
And I am the manager over our court to community programs. And as has already been said by our other treatment providers, these are our clients who care very much about what happens. We see them in our jail-based treatment all the way out to residential. And so being part of how they're treated and how we respond is very important to us.
I'm Steve Odorizio. I'm one of the county commissioners. You heard me earlier. I'm here because I really deeply care about this issue. Years ago, we had a member of our community come and show us the data and how it's impacting us. I had some personal experience with family members suffering from this, but then when we got to see how truly big this was in 2015. It's not gotten any better since that time, but we have established some infrastructure at Tri-County Health since that time, and we hope that this infrastructure, meaning this group of folks, will also take some of the resources that are finally starting to be freed up, available for all of us, try to address this issue with even more effectiveness.
Jim May, City of Northland, Chief of Police there. Actually, I represent the law enforcement side here in Adams County. We get together once a month, so I think law enforcement in general, we be in first contact in a lot of this. We see it one week, the next week we're on the corner. And so it's really impacted all of us. Our frustration is how do we get them in, quicker? Because right now we really don't have any services that have that side of it. So really look forward to the future. Also, my oldest son, he was addicted to drugs really bad. He almost died twice. So again, for my personal reasons, and it was a passerby that stopped that last time. And again, it takes multiple contacts and multiple touches to make sure that they can get help until they find hope, passion in why they need to get better. For him, it was a little girl, his daughter. So, but he was a lucky one. Today, we have even a worse thing with fentanyl being introduced to it. I have no doubt if fentanyl was around when he was going through this, he wouldn't be here today. So I think that puts a stopwatch on us, here in Adams County to make sure that we make those changes and get things for them to get that help. So again, not only represent law enforcement, but that personal side, make sure we can make a difference. Because we're tired of sending employment to people's houses. That pain.
I'm Phoebe Slotowitz, and I'm a co-responder of the City of Northland. So I work alongside law enforcement. A lot of our population is unhoused, and just working with them and talking to them about their use and the need to find more resources closer, because a lot of people don't want to leave the area. And just working with them, I have a lot of patience and compassion with them, and meeting clients where they're at and understanding that there is help out there is a huge thing that we do on the crisis response unit. Just finding one.
Again, Eric Garcia, City of Thornton. I've been a pastor in the city of Denver. I was a pastor for about 16 years, mostly in marginalized communities where drug addiction, alcoholism, gang involvement is very prevalent in families in those areas. I've been in the trenches of the opioid epidemic since the beginning, when doctors and Big Pharma were handing out, Vicodins and Percocets like they were Tic Tacs. You go in for a bruise and you get 100 Percocets. And it's very close to home. My mother, she was stage 3, stage 4 cancer, recently passed in September. I watched her addiction to opioids and pills. And also my sister has been addicted to meth heroin the last 8 years. She's been on fentanyl for about the last 2 years, currently homeless on the streets. And when I say the trenches, I mean the trenches of this opioid epidemic and being involved trying to save your little sister's life, and it's just, it's, even with all the connections I've had over the years all over, it's almost impossible to help someone that has, mental health issues as well as, once fentanyl came, it changed the game completely, and it's nearly impossible to find them help. I'm also very involved. I've done everything you can imagine to try to, given up hundreds of times and tried again and tried again and tried again. Most recently, I was just showing up at the park to love on my sister, love on the other addicts out there, help them any way I can, provide resources, and just love on them. Every day I was checking on my sister, saying, "Are you ready today? Are you ready today? Are you ready today?" She was about 80 pounds, just walking skin and bones. She was up to 25 fentanyl a day, smoking that. And just recently, last Saturday, when I showed up, she was ready to go in. So I was able to find a facility. Unfortunately, $1,300 a day. She's homeless on Medicaid. That's not doable, but I tried everything that I can to save my sister's life. So she's in detox right now, and hopefully, it's kind of impossible finding her an inpatient facility now that accepts Medicaid. There's either a long wait list, or you've got to pull out $30,000 a month. And so I went out with her, and we just got to find a way to get real, true help, and with people that are on Medicaid, are homeless, and that really need a streamlined process, and somebody that could hold them by the hand from A to Z to be able to get the help that they need. So yeah, that's why
I'm Claire Murphy. I am a school social worker for Mapleton Public Schools, so I represent the mental health team there. I'm also a licensed addiction counselor. And so I've been touched personally by opiate addiction and overdose, but working with my adult clients that are struggling with this disease, and also taking that passion and really advocating for more prevention and education and supports.
I'm Monica Igasa. I'm also with Mapleton Public Schools. I am the district nurse. I've never worked in the public sector, and it was eye-opening how young they start. Middle schoolers. It's scary. And I also have 3 kids, one in 9th grade, so it just hits close to home, but it's a scary situation we're in, so.
My name is Louise May. I work for the Colorado Consortium for Prescription Drug Abuse Prevention. I'm an external relations strategist. So I have a team that sits on the CU Anschutz campus. They run a lot of our work groups that address various aspects of the opioid crisis. My agency is the agency that coordinates the statewide response to the opioid crisis. My role, as well as Jennifer's role, as external relations strategist, is really to be able to help support all of you and be a resource to all of you. In addition to also being an advocate for the work that you're doing and elevating some of your pain points and your successes up to some of our state partners across the state. So really, I'm here to help give you what you need to be more successful in this work. And I think, you know, that's really one of the reasons why it's important to me, is to ensure the success of this group so that we are addressing some of these stories that everyone in the room have shared. And thank you all for sharing those personal stories that can be challenging to share. For me, what I love about this job, honestly, is hearing the recovery stories and hearing the adversity that so many people have overcome as they've worked through and addressed the disease of addiction. Unfortunately, I think we hear those recovery stories far too seldom. So for me, it's to be able to hear more recovery stories and to make sure that all of you are successful in the work that you do.
Good afternoon, I'm Jennifer McIntyre. I also work for the Colorado Consortium, and I've been around for 10 days. So what Lindsay said, basically. But my new territory is in the Northeast region, so I am the Adams County person. So hopefully we will continue to be meeting together, and I'll get to talk with all of you here at some point. I have a lot of goals to work with you all. My kids grew up in Adams County Schools. I see Lori Bailey over there. I came from Broomfield Public Health, worked in community coalition work. I truly believe in community work. And I'm so glad to see that opioid work is being given to the community to decide what we should be doing with the funding. And even if you put the funding aside, just to realize what our experiences are and what we can do together. My goal is that I don't have to hear these stories all the time. Like, personally, it's sad, right? I mean, that sounds so basic, but this is a sad space for a lot of people, including myself. But I want to be able to bring hope, and that's what I intend to interject into our space together. Thanks for inviting us in.
Thank you, everybody. Did we miss anybody for check-in? All right. Well, I feel like Gabe's trying to get out of checking in, so I was going to give him grace, but sorry, Gabe.
Gabriel Rodriguez, I'm with Adams County. I'm in the county mayor's office. I'm helping manage a project with Rocky Mountain Partnership. My brother's a local cop up in the state of Washington. He said it's more scary to him to get this call than go to call for COVID. So it just kind of put in perspective for me and what I'm doing here at the county, that he's more concerned about that on the streets than having to go to the house that it might be a potential COVID case. He sees it every day. And then I have a brother and father who's a fireman, so they tell me stories too. So mine is more of a personal connection with my brother, who's my father.
A lot of you have already touched on a lot of this. So talking about why we're here today, your check-in, that is why we're here today. And many of you know this, but the Attorney General and other local government leaders like Commissioner Mauricio unveiled a first of its kind joint framework. So there's a lot of dollars that are coming into our state over the next 18 or so years from these litigation settlements with from companies that have fueled the opioid crisis. We are one of 19 regions, Adams County is. The state has been divided into. Some regions incorporate several counties, and each one of those regions is charged with convening a council like this and looking at how they want to address the opioid crisis within that region. So I'm gonna give just a little bit of background information before we talk about the data. But this is how this council is structured. There are 9 voting members and alternates, and then we also have all of those content experts and community members with lived experience that are gonna comprise an advisory committee. Voting members do need to be elected officials or elected officials or staff of a local government, and they are really the ones who have to prioritize the work. The 2-year plan we talked about, decide what percentage of funds are gonna go to these 5 priority areas, and ultimately make the decisions on how those funds are gonna be distributed. So we'll talk about that process in a minute. And we have several of our voting members here today. Chief Judge Don Quick was unable to make it, and we do have Dr. Kelly Weinbach from Public Health who will be joining us a little bit later. But just thank you all of you for being here and for making that time commitment to be a part of this work. I mentioned alternates, so we are working on making sure that each of those voting members has someone that can attend these meetings in their place if they're unable to be here. And the advisory committee. So a lot of you got emails from me over the last few weeks about this. And I mentioned this earlier, but there's so much interest in being involved in this work. And so what I love about it is that it's kind of an open door policy. Anybody that is interested and passionate, has something to say, is invited to be part of the effort. Realize that we could benefit from a little more structure around what the advisory committee itself looks like. And so many of you are going to be at the state opioid abatement, the first opioid abatement conference, I think is what they're calling it, next week. So we're learning from other regions how they're going to be structuring those advisory committees. So more to come on that. But really, this is anybody who is touched by this crisis, has content expertise or lived experience to help provide those 9 voting members with all of the information that they need to make the best decisions. And I just want to also recognize that we don't know what this work is going to look like. So in the future, there may be some subcommittees that are developed with both voting members and advisory committee members. It's kind of up to this group to decide what that looks like. So myself and the team in the back are the Rocky Mountain Partnership. I mentioned we've been contracted by Adams County government, who is serving as the fiscal agent for these funds, to be the backbone for this effort. And I want to introduce our team before I talk about what that looks like. We have our Chief Executive Officer, Lysandra Gonzalez, Ben Nash, Ben, can you please remind me your title?
Manager of Information Admin and Special Providence.
Ben was in AmeriCorps Vista, and we liked him so much that we kept him, so he is a brand new full-time team member. Ashley Edinger, Senior Director of Strategic Supports, and Diana Bustios, Director of Communications, who will be taking pictures today. So our team is facilitating this regional council, but that is so much more than just setting up a meeting and making sure that you all are fed. We are doing a lot behind the scenes to make sure that we're putting information, gathering information that already exists, gathering and getting new information when it doesn't exist, and packaging it in a way that really helps you all to connect the dots. What are the specific unique needs of this region? I mentioned this interactive data dashboard. We're going to talk about it a lot today. There's a lot of information there that it's not just quantitative data, but understanding who's already doing work. Where are there gaps in work that's happening around this? What is the policy that impacts this issue look like? Where's the funding going? And what are those voices? There's a lot of qualitative data that we're synthesizing as well. Our role is to ensure that there's alignment with this group and the statewide joint framework that all local governments have agreed to, and make sure that the funding is awarded in the way that is going to have the most impact. And so providing this council with all the tools to make sure that that happens. Some of you have seen this before. This is from the AG's office, but the dollars that are coming into the state, 60% of all of those are going to those 19 regions, Adams County being one. 20% of them have been offered to local governments, And they have the opportunity to opt in and say, yep, we're gonna keep this local share and do something within the confines of that joint framework ourselves, or we don't want to have to report and decide what to do with this money. We're gonna opt out and put that into the regional pot. There's no right or wrong answer with that. I think we have a mix of both with our municipalities here. And they, just as an aside, are able to change that decision in the future. So we'll talk about what these numbers look like. There's also 10% going into an infrastructure fund and 10% going directly to state government to operate this work. So how much money is Adams County actually going to get? Later this year, hopefully quarter three, end of quarter three, quarter four, talked with the AG's office earlier in the week, and they're still waiting for that firm date from the national distributor. But this region stands to get about $2.97 million for 2022. That's going to be a little bit more than when you look into 2023, and I think that just has to do with the timing of getting everything set up. Because 2023 and 2024 is about 1.2, 1.7 million. Over the course of 18 years, this region is going to get just over $21 million, which at first glance kind of sounds like a lot, but it really isn't. And I think everybody in this room also knows, I mean, over 18 years, there's so much work to be done, that this is great that there's this funding, but this council has the opportunity to do so much more, including looking for other sources of funding, which is another role that the Rocky Mountain Partnership is able to play in pulling in other sources so that the infrastructure that you're setting up can be used to distribute other funds to address the opioid crisis, not just relying on these dollars. And I don't know if I mentioned this before, but if you have any thoughts or questions as I'm going, please go ahead and stop me. I'm happy to answer any questions.
Jody, can you also put the volume up a little high?
Is it hard to hear you back there?
It's not terrible, but just.
Okay, so I'm gonna yell at you guys. Okay, so what can this money be used for? I mentioned that there are 5 priority areas that the Attorney General's office has put forth. The first being treatment and recovery. Oh, yes.
I was just gonna interject really quickly and give some clarification for the funding.
Yeah.
The reason that it is higher is because we do have some funds that are sitting already within the state from a settlement earlier last year. And these numbers could, just to remind everybody in the room, could change depending on additional settlements that are still pending within the court system. One we just had recently finalized, but there are others. So these numbers will probably fluctuate as we go forward.
Thank you, Lindsay. That's super helpful. So what can the money be used for? Treatment and recovery, there's a long list. We're not gonna go into all of the things on that list today, but I can also make sure that that does go out to all of you as a resource. Wanted to mention that detox is lumped in to the treatment and recovery category by the AG's office, but I know that it's not always considered treatment, it's kind of pre-treatment. And so from a data perspective, we have kind of identified detox as its own category. I wanted to name that. Evidence-based treatment models for intervention, treatment and diversion strategies, wraparound services related to criminal justice, as well as prevention and education, harm reduction, and then of course other, because there has to be a catch-all if there's something that they hadn't thought about. So if there's something that doesn't fall into these categories that this group thinks is really important, the office is open to that. This could include funding to go around data collection or research, but just know that they kind of left that door open. There's these 5 and. So what's being asked of this regional council is to distribute these funds. And in order to do that, first we had to confirm voting members, which of course we have done, and now develop the 2-year plan and submit that to the Attorney General's office. Once that's done, we're able to start the process of asking for letters of intent and having folks apply for those funds. And then as soon as the funds get to the AG's office in Adams County, we can start distributing them. But again, that date is not official just yet. So I'm going to walk you through what's included in the 2-year plan, but I want to caveat that by saying what we have to submit to them soon is way less scary than what I'm about to show you. So the 2-year plan wants to know what are the measurable goals and objectives for the next 2 years that this region wants to accomplish, and what percentage of funds are going to these different areas. They're also interested in how the plan is going to address the unique needs of different populations, describe, of course, the new initiatives or how we're expanding existing programs, what collaboration looks like with other regions, if there's any infrastructure needs, which I happen to know that we do have some in this region, and if those are included in the 2-year plan or not, how we're utilizing other funding streams in addition to these litigation settlement funds, and any additional outcomes that you'd like to see. All that we have to turn in by September 15th are these first 2. And if you change your mind, that's okay. It's not set in stone. This is really, I think I mentioned this, but it's how you all are deciding to prioritize funds for the 2 years. It has to include those 5 areas, but you do not have to allocate funds to all 5. In fact, I think the Rocky Mountain Partnership team would make the strong recommendation that in order to not water down the funds, it would be something to consider prioritizing a few that's going to have the greatest impact over the next 2 years. I mentioned that it's not set in stone, so if you submit these allocations on September 15th and then realize as more data comes in or as the work continues, it can change. And are we behind schedule? We are not. Other regions have submitted 2-year plans. They have received planning grants, so they're on a different timeline than this region. We are right on schedule right here. And so it's not apples to apples with every region across the state. And so wanted to also name that for this group, that we're in a good place time-wise. I'm gonna pause because I feel like I've been talking for a little bit and see if anybody has any additional context they would like to add or anything that they would like clarified. Commissioner.
One of the things I think is important is that we kind of set the expectation that, if you go back to that one set of slides, I'm sorry.
That's okay.
All the way to where it says what we can spend the money on.
Yep.
I know one of the reasons, one of the things that we're trying to do is the state is going to provide a framework of how to categorize the different types of services, approaches, and efforts somewhere within this type of framework that we see here, correct?
Yeah.
And so I think what we need to keep in mind, because I know we have lots of partners here, lots of agencies, is as we do our assessment, kind of an asset inventory, that we not just, that we give each other enough grace and look at the big picture, because there may be things, there may be categories or subcategories of services that we don't have in the community. And one of our concerns is that if everyone in here says, ooh, I want a piece of the pie for my service, you're here because you exist. I'm not saying you don't need more resources, I'm saying that some of you do, most of you do, but I'm also saying let's remember that there's folks that are not in the room advocating for services that we might need. And so if there's a gap, we're gonna have to be aware of that by being self-aware of our limitations and where we need more help. So I just ask that we all kind of help remind each other, that includes us in government, it includes the nonprofits, that wait, we don't have somebody to do this piece, and it is important. And you understand what I'm getting at. If we all allow everyone to fight for a piece of the pie for their own piece, there's still gonna be gaps, and those gaps are gonna grow. So I just ask that we just keep that in mind as we do this asset inventory, and look at the big picture.
Commissioner and Councilman, yeah, I recommended that maybe we add into our values for the group and how we show up. And then know that the role of the backbone team, the Rocky Mountain Partnership, we're neutral. We are not a direct service provider. Our role is neutral to everyone's agendas, but not neutral to the result. So we can help keep that balance as well as part of our role.
I think that's important, that Rocky Mountain Partnership is our facility. And so you are the objective, ones that will kind of keep us in mind of the ones that will take growth.
I mean, if you bring me chocolate. No. Yeah.
It's just chocolate.
That is fine.
I appreciate it. And I know that comes across kind of rude that we're needed to, but I think everyone knows where I get.
I think it's important.
And let's also be aware that part of the creativity of what we have is that we could also fill like gaps together. We may not have to do it all within Adams County. We may say, let's work with Jefferson County and put a facility that fills a gap in both jurisdictions along Sheridan. We can do the same with Arapahoe County along Colfax. You see where I'm going? So we're not limited to internal collaboration. We're open to also external collaboration.
I would say even beyond open, committed to. Yeah. Oh, sorry, you guys already saw this, hold please. Okay, so we have a timeline and roadmap that I want to share with you for how we're going to do this. And caveat again, that if the council decides that anything on here needs to change, it can. There's very few things that are set in stone. So to kind of fast forward today, August 12th, so this meeting today, hoping to walk out of here with those an initial measurable target, as well as some draft allocations for those priorities. I mentioned the first annual opioid settlement conference is next Monday and Tuesday. I know a lot of you are going to be there, or folks from your entities are going to be represented there. That is going to be a fantastic opportunity, to Commissioner Mauricio's point, to hear from other regions what's happening now after having a better understanding of what's happening within our regions, to see where there's opportunities for collaboration. The deadline for municipalities to opt in or out of that funding has been extended. That's now August 17th. I think there's only 2 that still have to make that decision. And then that information will be public. And so we'll be able to share that on a dashboard that the AG's office is developing that will be linked on the Adams County dashboard.
As of last night, you only have 1.
Oh, only 1 left. Okay, thank you. Because we're recommending today that we come up with draft allocations, after this meeting and through early September, would like to recommend to this group that we allow additional input for stakeholders who aren't able to be in the room today. We have a lot of folks that are committed to this effort, but weren't able to make the time commitment to be here. And so the Rocky Mountain Partnership team will facilitate getting that additional input from other types of stakeholders and bringing that back to the council virtually to make an official determination on what those allocations would be. We're also working on an IGA that will be sent out to municipalities in early September, asking that is signed by the end of September. And then I mentioned confirming the allocations, and then September 15th is when the 2-year plan is due, just those allocations and targets. Projected that this council would be in a position to start accepting letters of intent after that 2-year plan is submitted. The process here is not intended to be a business as usual. Part of the value that our team is bringing is able to say, okay, let's put out a request for LOIs. We know what the priorities are for this region, and then let's work with all of those entities, some of whom might be in the room today, to identify where there's opportunity for alignment and strategize joint applications before those get in front of the voting members. In October, we'll bring this group together again to talk about the policy priorities related to addressing the opioid crisis. I heard in the check-in a lot of you talk about that there's so much work to be done, that there's not enough being done. And I think that here's where the opportunity is for this group, to not only to look at these dollars, but also say, what are the policy implications from public funding standpoint, but also, not funding related policies that this group can put their weight behind, also through the Rocky Mountain Partnership, and say, we want to advocate or, promote these policies that are gonna affect the opioid crisis. The targets that you're gonna be setting today, we'll dig into that in a little bit, will not call out specific population, and that is just because of the timing of the data. It wasn't available in time, but we will get it this month, and so we're recommending that we're gonna add in specific numbers around community members of color to that target. So put a pin in that for now, but we'll come back to it. At the end of October, we have it slated that you'll actually be accepting proposals, evaluating them in December. Adams County government is the fiscal agent, and so the recommendations from this group will be taken to the Board of County Commissioners to approve, and then those dollars will be able to get out the door, projecting that to happen between December and January based on timing of when they actually get the funds. that's kind of the timeline for 2022. I'm gonna pause again to see if there's any clarification needed in that. I know that some of these things we're still gonna dive into a little bit more. Okay. For 2023, we have slated that we're going to have a fiscal map available to this group in that first quarter. Part of what we are going to be mapping is not just the public, but also the private dollars. So this group can also do some strategizing around how to leverage existing dollars in addition to the policy work of identifying where other dollars could potentially get put towards this effort. Having you meet in quarter two, we'll also be asking that every entity that receives funds from these litigation settlement dollars track key performance indicators or metrics. And so you'll be able to see in real time, are we trending in the right direction? We aren't gonna know all like big data points that take a year to understand, but there's gonna be data points that you'll be able to look at on a regular basis and see if strategies that you're funding seem to be working and if there's opportunities for improvements. As we end the year in 2023, continuing with the policy work, accepting LOIs for that second round of funding. The exact timing will depend on when exactly it comes in 2022, because then it will just be recurring on an annual basis to start getting funds out for the next year. All right, so when we think about this opioid work, and again, thank you, Commissioner Odorizio, for already touching on this, but this is big, and not one single region or even one state is going to be able to change everything on their own. And in order for us to have the greatest impact, it's really critical that we understand who those players are, who has a major strategic plan, who has resources, and how can this plan be mapped or aligned with those existing strategic plans. So we've taken a first stab at understanding who is it that has the authority and influence in this realm and or over how funds to address the opioid crisis are distributed. This you can find in our data dashboard, but pulled it in for you here. So at the national level, the state level, and then the regional or local level, there's lots of entities that have strategic plans, agendas, and or dollars that they're giving out, or if they're not giving those dollars out, influence over how those are being prioritized from other sources. And so what our team has done is kind of a pull of some of these, of all of these entities to say, what are all of their priorities and where is there synergy between them? So the priorities that have kind of come to the top, number one, invest in and expand access to evidence-based prevention, treatments, and harm reduction efforts. Research the impact of policy on behavioral health outcomes. Decreasing opioid-related deaths, which, spoiler alert, is the target we're going to recommend to you today. Consolidating data and information around the crisis. Providing training to direct service providers regarding best practices. And that says the same thing twice, Ashley. So, ignore the last one. How is this resonating with folks? Is this exactly what you would expect to see? Is there anything missing that you would expect would have been on this list? Lindsay?
I'm just not sure if any of those specifically relate to any criminal justice aspects. So that would be the only thing that I see that's missing, potentially missing.
Okay. Is that a hand one? Okay.
Not that you need all five, but.
Right, no, that's an excellent point.
Good, as we're doing your needs assessments, make sure that you're including that as part of the needs assessment.
Welcome, Kelly.
How about strategies that address upstream risk and risk and protective factors?
Okay.
Julie is also the convening work group stakeholders in the community to address the problem. It's a priority that's missing from this.
That's what's in, which is exactly what we're doing here today. Fantastic, thank you. We'll get that fixed.
I would say one thing that you're missing from this group is your recovery community.
Yep.
I'm sorry.
The recovery community, people in recovery, don't seem to be represented in the room today.
We do have some of them coming. They weren't able to be here for the whole day. So we do have some folks that are excited to join you later this afternoon. But thank you for recognizing that, because that is incredibly important. So all of those organizations, sorry, my animations. On the dashboard, we have an actual database, a spreadsheet that really lists out their specific priorities because they're not all matched up. So if anything is missing from this list, of course, please let us know so that we can make sure that we are capturing that. So with that in mind, kind of setting the context, I want to welcome Ashley Ettinger up to talk to you a little bit about the current state in Adams County and bring to life the data.
Hello, let me know if you can't hear me. I tend to have a quieter voice, but I'm trying to make sure it carries all the way to the back of the room. So when we think about the current state, we're going to dive into some data today, which I'm really excited to share with you all that we've put together. A couple of quick notes before we dive into that data. This data is really intended to be used as a flashlight to illuminate opportunities for you all to work together, right? Rather than as a hammer. I think everybody is on the same page here in this group, but just wanted to say that out loud. In addition, the data that you are seeing today, we are using the best publicly available information, and we will continue to build on this information as more becomes available. Jody mentioned that there is some data coming to us at the end of the month. What that currently includes is disaggregated data around opioid overdose deaths, hospitalizations, and emergency department visits. In addition to that, we will be getting some data about unintentional versus intentional deaths, and we will be getting updated data around Narcan use beyond just emergency departments. So we have data for you today about EVs, but we'll have additional data at the end of the month around that as well. The information that you're going to be seeing today has been informed by Rocky Mountain Partnership partners, folks in this room, and aligns to what other entities are looking at. Here's just a small list of the folks who have helped inform what we are putting in front of you today. And we are ensuring that all the information that has been brought to you is sourced from reliable public entities. So there's a lot of local, state, and national entities whose data, information, videos, stories, all of that you'll see today came from, including our Colorado Department of Public Health and Environment, which is probably the vast majority of the data you'll be seeing today. Around the room, you are going to find 5 data sessions. They're marked out by each of these flip charts around the room. We have one that has data around opioid overdose deaths, one that is focused on hospitalizations and emergency department visits, one around Narcan naloxone use. Impact on individuals and families is a station, and we also have a station that has some data around impact on the workforce and the economy. At each of the stations, you will find data. It's not on the wall, it is on the tables, but it is there. There are printouts of graphs and different information for you. There is a laptop for exploring the dashboard if you'd like to dig deeper into each of the data. And there are flip charts around the room that have questions for you to think about. They all have the same questions, so this won't surprise you, but as you're exploring the data, we're gonna get up in a second, get you all moving, allow you to talk to each other about the data, thinking about what stands out to you and what questions do you still have. Before we get into the activity, does anybody have any questions about the types of data you're going to be exploring today? Perfect. We're going to break you into groups and have you explore data. You'll spend 10 minutes at each station. You will get to explore all the data, so no worries if you have a specific data point you're very interested in. In your group, we're going to ask that you review the data, discuss the guiding questions as a group, and then document those major points, answer those guiding questions. So what are the things that stand out to you? And then what are those questions that you still have? After you spend 10 minutes, we're going to rotate you to the next station so that you can explore another set of data. And since there will have been a group that was before you, we'll ask that if there are other things that they've already listed that stand out to you, or other questions that you still have, that you just put a check mark or make a note of that. Then after you've had a chance to explore data at all 5 stations, we'll come back as a large group to share ahas and what Jody mentioned earlier, to set a measurable target. We'll get to what that looks like in just a minute. But before we actually break you up, are there any questions? Perfect. I'm actually gonna have us number off, and I'm gonna start with you, number 1 through 5, and then that'll designate which station you'll be going to. Jody has numbers written on the flip charts.
Okay, 1, 2.
We'll hop back to the table here.
5.
1. Go to Alex.
3.
1.
2, 3,
4. 5.
1.
3. 4.
5.
1. I think I got everybody, right? All right, so we're gonna start 1, 2, 3, 4, 5 are the stations. So go to your number station. I'm gonna ask you to just push in your chairs so that you can not be too cramped at those tables. Nope, so all the data is printed, but there's also a laptop that has the dashboard if you want to interact with it. Yep. And there's passwords for each laptop if they turn off, except for the one by you, Chief Managing.
Jody and I will be walking around if you have any questions or need any support from us, but
yeah,
we're excited for you to explore the data.
So instead of OBH.
We've got 1's over here, 2's in the corner back here, 3's in this corner, 4 is over here in the middle, and then 5 is in one corner. Are you number 4? There's gotta be more 4. I don't know number 4.
Monica? So we need to add.
Where are the 4s? Probably a 4 with you. Yeah, let's get it. Love it.
Got it. So we'll add those.
You probably are. Just stick with the 5s. You'll get a chance to look at all the data. So just
Yeah,
throw it
thank you.
back up.
That's super helpful.
That's, we make it up the streets.
Visiting them. Right, I'm back to their story, their business. She said, what? The clicker? Oh, okay, that's. My mom. It was their kid there.
Out of water.
So he was. Hours ago. Don't know what's going on. I know, they're in my team too. I'm like, did I die? Westminster Public Schools drive just more in the work process, and also train every staff member and give her a kit to every staff. And she has it, and she never got that.
All right.
To check in with them.
If y'all could wrap up your conversations, I know there's a lot of robust conversations happening around data still. We're gonna come back as a large group, but stay at your stations.
Don't need much. And there weren't even.
I will.
Go back.
Station one.
Okay.
Oh, we're supposed to stay at whatever station you just finished that.
All right, we are gonna come back as a large group, and I'm gonna raise my voice so everyone can hear me. I'm gonna command the room a little bit. You all have had the opportunity to dive into 5 stations worth of data, and I'm so excited about the conversations and the dialogue that you've been having. What we're gonna do now is I'm actually going to pick on each station to share out what your biggest things that stood out to you about the data and some of your questions that you had. Just pick a couple things, either things your group lifted or things that previously groups lifted that were big wonderings for you as well. I'm gonna start with this group right here, just to pick you off. If somebody could share which data you were looking at as well, that would be helpful.
Sure. This particular station, to remind people, is inmate population and child welfare and the impact of opioids on individuals and so one of the ones we struggled with actually, so we were unhappy not to be started back where we started in the first conversation, but that's okay. So one of the conversations that we had really was about balancing law enforcement and care and figuring out what's the right balance. If things are decriminalized, then are people voluntarily going to participate in assistance that comes from the police department? If we jump straight into punitive measures, then we miss opportunities for treatment and for recovery. So that was a big challenge for us. The fact that we have family treatment courts in Adams County, but they're not necessarily well resourced, means that we have an overlap immediately of child welfare into criminal systems, and then we have children who suffer any number of things in that particular process. And then a couple of notes from other people looking for what are the long-term supports are we providing the assistance to inmates that is useful to them while they're there, or when we hit the end of a period of time, are we simply dumping more victims back out onto the street and into the community? And then looking for data around a couple of areas like what's happening in our child welfare system. These notes had specifically to do with programs that assist mothers and parents of dependent children from necessarily entering into situations for addiction, but not necessarily what happens to children in foster care associated with that. So a little bit more information, spreading that out just a little bit around what can we do, not just as preventative behavior, but what can we do in treatment areas. And then, of course, looking for all of the overlaps of the kind of data that we have here. So this is one set in isolation, but how does that play into hospitalization and death? And how does that play into Narcan and preventability? And how do people going through the punitive systems or jail systems, probation systems, then play into the eligibility for jobs and the ability to get jobs, the ability to work for companies that are licensed through DORA, the ability to go and get certification or education if most of the granting agencies disqualify you if you have a drug charge. So that's where we are.
Thank you for sharing, group 4. I think that's what your number is. Five. Group 5. All right, we're gonna move to this group over here. I know you all were diving into emergency department visits and hospitalizations. I'm the spokesperson, all right. I think we just had questions around, jumping ahead, we started with naloxone overdose use in emergency departments, and it does not match the percentage of people who are being hospitalized. The age ranges are different. So what is contributing to that difference? And also that overall hospitalizations are going down. And what are the other maybe systemic things happening that's contributing, whether it's access? Is it that Narcan is a lot more available, so people are being rescued at home or in the community more than in the hospital? Something else that stood out for us across all of the data is everything is male and female, so there's no tracking of trans or non-binary folks. And that's definitely a higher risk population, so what's kind of happening there? From other teams, number of home deaths versus hospitalizations. Anything else to add?
And then we were talking about just more prevention and education programs for nursing staff, doctors, more trauma informed on how they address these issues. And basically everyone in the community just educating, more education needs to be done.
Thank you so much. I'm just capturing your aha so that you all have them up here. We'll go over and head over to this group over here who's looking at Narcan use in emergency departments.
Okay, whatever they are, just kidding.
I'm gonna just mess it up at this point. Y'all can create, we don't even need to do numbers, you guys can create group names. We can dive in. Who's gonna shower from this group? Got it. I've got no smells over here, somebody's got to talk.
We talked a lot about the Narcan use and how we were curious about, it's just the use of who did it, and was it paramedic or is it just in the ED? What else? We didn't do much right on this one.
And I think one of the things, just to piggyback on what she was saying, we talked about also is stigma around Narcan, especially with low socioeconomic communities. Stigma around, for example, we work with a lot of Hispanic, Latino parents who they will not, if you give me this, I will not inject this, I will not give this to my son, I don't trust the government, I don't trust the medication. I had a African-American client who told me, I'm not gonna be a guinea pig for another Tuskegee project based on the information of this, what you're giving me. So there's a lot of stigma around lack of knowledge and just trust in the system.
Thank you. We're gonna head to the group that is in the back corner over there.
We had opioid-related overdose deaths.
I think we spent most of the time talking about how some of the numbers looked, it kind of conflicted, the community members of color, deaths, they appear to conflict with some of the data. So we're going to talk about that, got some clarification.
I would say there wasn't really anything that was a surprise out of this data set, especially if you look at the urban deaths, what within the opioid grouping, where the deaths are occurring, it's fentanyl, are synthetic. There wasn't anything. We have much more robust conversations in the data sets, to be honest with you. This was pretty straightforward, and we had a lot of questions about the way that the data was out there, trying to understand it, to really get into it.
I think one thing that stood out to us with this data was that when you look specifically at counts, white population was at the top, with Hispanic white population being secondary when you look at counts, but then when you look at aggregates, white Hispanic goes clear to the top and white actually goes to the bottom. So there's a higher percentage of white Hispanic that are being affected than the white population overall. So that was one thing that I just remember thinking that was really interesting. Otherwise, I would agree. I don't think anything else on there stood out.
Great. Also, please feel free. I love what you all just did and just like build on what other groups are sharing. So if you all have at the remaining, I think we just have one group left to share out, but I definitely want to hear those insights as well. We'll head to this back group in the corner over here. Last but certainly not least.
Chief.
Chief stands
Well, I
alone.
can tell you one thing, everybody hated the 27,400 number. But other than that, I think that's one thing that we've seen the impact on, again, with our workforce, what's we do. Again, and I guess what I heard was that this topic is one that a lot of councils is gonna make their number one priority because of the job loss, how do we get them back into the workforce? Some of the things that provide, those providers are actually paid that support, so.
This is a stretchy one. When you start to ask about the data and how they arrived at the data, there's a lot of assumptions made. So I think if we were to choose this as a priority, we would want to actually get Indiana.
Yes.
So it said,
Yes.
we have to figure out how to apply Indiana to Adams County and get our numbers, because these numbers make a lot of assumptions that we struggled with this one.
I think the qualitative perspective that was added by all of you as you were coming around through this is that it's really 3 areas. Community member who's experiencing the addiction and the struggle and ability to work and have the income they need to take care of themselves and their families, but then also to the workforce in the field to address the opioid epidemic. Do we have the talent in that space, and are they earning a wage that actually allows them to do that work without struggling and live in the community that we need them to do this work? And then the third is the impact on the employers and the community as a whole without having the labor force that's needed to run, business, critical jobs and industry work. So it's like 3 major areas that are all working together in one, and dangerously without accurate information, because who's collecting it, who's looking at it, is something we really need to hone in on.
And I think if each state, or each of these areas, we were looking at which of this is Colorado data, which of this is Adams County data. Can we get a better breakdown on Colorado data? I'm sorry, on Adams County data, so we can see what's happening by community and by region. I know in a lot of data, a lot of rural Adams County gets grouped into Brighton because it's the code 80603. So are the Brighton things actually the things that are affecting the rural Adams County area? The 80602 zip code is a Brighton zip code, but a lot of it is more closely associated with Thornton. So how do we get the right information to make good decisions?
And actually, I'd add that as an action commitment is, I think the narrative of the unique state that we have of rural and not as rural, suburban, is something that we need to feed into the current state of what we're looking at. And then that, to Peter's piece, is how can we get, I don't want to say creative, but really get the information that we need, or start putting the infrastructure in place to have access to that information, because sometimes it's just not available, but we need to make sure we have it.
Absolutely. That's one of the biggest themes I heard on every single conversation I leaned into, was around that need for additional data infrastructure that doesn't exist, or like really getting creative on how we understand the current state. And that's why I so appreciate all of your insights, because this is going to help you all make better decisions as a regional council and a group of decision makers here in the room. And it's also going to help us ensure that we have the information that you all need to do that. So that's really exciting. Before we move on and kind of think about how this data can help this group start thinking about towards that 2-year plan and that action. Does anybody have any questions or final thoughts about the data? Fantastic. Before we dive into the rest of the content though, we are gonna take a coffee break because I feel like everybody, there's a lot of energy in the room, but why not also get some caffeine in you, some snacks, all of that good stuff. There's still food in the back. We'll come back in, how long are we gonna come back in, Jody? 10 minutes? I am channeling my inner Matthew McConaughey. We're gonna get back into the content, so if y'all would please take a seat or stand around the room wherever is most comfortable for you. This is a flexible space today. Now that you've had some time to get some more caffeine into you, we're gonna talk about targets. As Jody mentioned earlier, one of the milestones that you all are going to engage in, actually right now, is to develop a measurable target for the next 2 years that calls out specific populations impacted by the opioid crisis. And I'll just say out loud that this will be one target that we're gonna recommend that you set. And as Jody noted earlier, when we receive that updated 2021 disaggregated data, that's when you all will come back together and think about what that specific population or populations will be. So our recommendation is that you all as a regional council set a 2-year target to decrease opioid overdose deaths in Adams County. That's what a lot of you all have mentioned. That's what other entities are looking at. And that is right in alignment with the 2-year plan that you are developing and is in fact a big part of that. And then we've already talked about the 2021 data. Below are 3 options that our data team has put in front of you as an initial target around reducing opioid-related deaths. Something that I just want to say out loud is when we think about target setting, one of the big pieces is setting a target that is a little ambitious and that we want to work towards. It's not going to be super easily attainable with like very little work, but also we want to make sure that it's realistic, right? And so we've got 3 options here in front of you and are also open to modifications. Just want to say that out loud too. By the end of 2024, reduce the number of opioid-related deaths, including fentanyl deaths, by 10%, by approximately 22 fewer deaths. Option 2, reducing by 20%, approximately 44 fewer deaths. And option 3, reducing by 33%, approximately 67 fewer deaths. Now, I just want to call out that on first glance, these numbers look really small, right? I can see it on folks' faces. Something to keep in mind is that these targets are not only just about reducing the number of people dying, right, from opioid-related deaths, but it's also about stopping that trend upward. So over the next 2 years, your goal would be to stop that trend from continuing to go up and start to go down. So that is a little bit of a heavy lift. So when you think about it, yes.
I do want to just, as we look at these as smaller numbers, I do also want to ensure that we're thinking about that iceberg effect, right? The tip of the iceberg. So even if we're talking about reducing only 22 deaths, that is potentially reaching exponential amount of people with the things that we're putting in place to address the others that are not counted under opioid deaths, right? So we know from CDC data from 2015 that for every 1 death, there is 18 more people that are affected by a heroin use disorder, 62 more people affected by an opioid use disorder, so on and so forth. So thinking too that even if we're bringing down these deaths, how many more people we might be impacting by the plans that we're putting in place to help address that. So even though the numbers may look low from a death perspective, it's really making a larger impact.
That's a fantastic point. It's something I encourage us to add in as part of the target, the implications of what this reduction has. The other thing I will say is you are going after systems change. You're going after setting a trajectory that will change that trend line, stop it from increasing and then trend in the right direction. And that is, this isn't just a person in one hospital being saved, right? It's not one life, it's actually a systemic change that will result in this. So I think that's the other part of the story, I think, that needs to be told when we share out the target.
Absolutely, this is exactly what was just lifted. This is about systems change. And so wanted to get ahead of a couple questions before we dive into some conversation about this, because I'm really eager to get your thoughts and also have you talk amongst yourselves on how you'd like to move forward with a target. So why set a target on opioid overdose deaths? As you all saw in the data earlier, opioid overdose deaths have skyrocketed, especially in the last 2 years. And it's clear you all have identified in your breakout groups that action is needed in this county and this region and the state and the nation to reverse this trend. But we're really focused on Adams County. This is one big population level data point where it's super clear what way our community wants this to trend. I think you all have said out loud, nobody wants to actively increase the number of opioid overdose deaths, right? And this is actually what a lot of other entities are already looking at. You saw in the priorities earlier that many of those big dogs in the opioid field at a national, a state, and a local level are looking at reducing the number of opioid deaths, knowing that, as was mentioned, the impact is much larger than that. It's not just about saving a couple of lives. And so there are other data points that some folks may want to set targets on, right? But when we think about hospitalizations, emergency department visits, Narcan use, all other data that you explored today, since those are life-saving measures, we as a community do not necessarily want to see those go down if that means less lives would save. So when we think about the bigger picture population-wise, opioid overdose deaths is a great data point to be able to see larger term impact, knowing that one of the other steps that this regional council will take is to set targets around things like funding distribution and programmatic targets. How many people are being served? What is that larger scale impact? And then any questions before I answer a couple other ones? Yes, Commissioner.
So whenever we talk about these targets, I guess my question will always be, let's say we want to reduce 10%, 20%, 30% deaths, whatever it may be. How do we identify causation versus correlation? Let's say it goes up 40%. How do we know it's our fault? If it goes down 20%, how do we know it's our credit? So.
I see, well, see a hand here.
I was going to ask a similar question, but phrased in a more geeky way. Would be, from an epidemiologic standpoint, we would want to actually be looking at statistically significant change, not just a cut percentage, because the statistical significance is what signifies that our interventions were, it wasn't just due to chance, if that makes sense.
Absolutely. And so our data team put our heads together to put some recommendations in front of you. There was some statistical work that went into that actually our data director is not here, so you could go into the really minutia of what that looked like. But in some, actually, I think it might be answered here. Yes. So our data director actually did a lot of that work behind the scenes with other folks on our data team and other entities who were able to provide input in advance of this session. And we're able to develop some forecast lines that establish some predictions of what overdose deaths would look like in 2022, 2023, and 2024 if nothing changes. Yes, Levon.
Is this according to CDPHE, or do we have other local, we use the coroner or the public health department, or I don't know.
Yeah.
Not my world with deaths, but I mean, the CDPHE data, our group all thought that it seemed pretty low.
Absolutely. So the recommendations here are based on the Colorado Department of Public Health and Environment data. We actually talked to them. They said there's no really big statistical difference with the coroner data because all of that data reports into CDPHE and they take the load of aggregating it across county and across the region, across the state.
Anything you want to add to that?
Let's say the CDPHE data is the best available data.
Any other questions before we get into minutia? I just wanted to call out really quickly about how those draft targets were determined because I think this is going to answer some of the questions a little bit more in depth that you all shared. After those forecasts were developed, recognizing that you all have listed that the desire of the community is to reverse this current trend, there were statistical ranges that were established for where data could result in 2024 based on different intensity levels of action that could be taken through the 2-year plan. Now, we're not going to be able to attribute all of what happens directly to our efforts, right? There's a lot that's in play, right? It's that correlation of versus causation. But if we do start to see a trend in, that's where the next level of data points that we're going to track alongside opioid overdose deaths and that bigger population level is around key performance indicators and looking at some of those more programmatic metrics, looking at smaller level data points that are not these big population, huge population changes, because that is where you're actually going to be seeing the most tangible impact And we know that all of those key performance indicators will ladder up and impact this larger population level target.
And I'll just, yes, exactly, Commissioner, to this.
Yes,
To the
absolutely.
end. And the beauty of, I think, this is that we're able to then support those who are going to receive funding to do the same. So that it isn't a spray and pray, and it isn't a everybody run and see what you can do with money, but it's actually like, what is it that we're trying to impact, and how do we ensure we have the greatest impact with the resources and all of the practitioners, like putting their efforts towards that.
Absolutely. And that's
gonna have key performance indicators in the line, which is amazing.
And that's what's gonna happen at the next meeting for the Regional Opioid Council, right? In October, you all as a regional council will identify what those key performance indicators are. That's gonna line up really nicely as you develop the funding allocations for the 2-year plan, and then start to release the LOI for fundies for folks who are interested in receiving funding to submit. And so that'll be kind of the start, knowing that you will continue to identify key performance indicators ongoing and measure the progress and impact. I do want to allow for some time and discussion at your tables to be thinking about those targets and dive a little bit deeper into those. Before we do that, does anybody have any additional questions? I know we're still in a really heavy data portion of this time together, but I'm excited to hear what you all think about these targets.
I guess I understand the concept of the pyramid and the number of impacts it takes to get to the point of that depth, but I don't know what other measurements we have to look at. What are we doing? What does that mean in terms of prevention? What does that mean in terms of treatment? What does that mean in terms of treatment in the moment to get to 10%? What are the programs that have to happen in order to stack up to that 10%?
That's exactly the question, Councilman. And we often approach work by what is the work that we're doing, and then what is the result, as opposed to what is the result we need, and therefore what is the work that needs to get done to hit that result. And that's a comfortable space that this council is going to be approaching, is flipping that on its head and saying, all right, let's talk about the end game, our result. Now, what is it going to take to hit? And so those will be developed as part of that.
I love that you are already thinking ahead to that, because that's going to be so important. Is there another hand?
I think, yeah, thanks. I think that the goal, the target in and of itself, while it's obviously very impactful, it's in the negative. And I'd like us to consider how to sort of reframe that in a way that is sort of incorporated. In other words, we want to, decrease the number of opioid-related deaths that are statistically significant by increasing the number of, treatment centers, or the amount of care, or the access to care, or which is not something that we looked at the data points around that, but I know that we don't have a lot of treatment in Adams County. There's not a lot of care, and so for me, while it's very significant, it's a negative. I call it a dead person goal. Like, a dead person cannot use drugs. And so it's what is the positive outcome that will happen as a result of reducing our number of opioid-related deaths that, in a statistically significant way.
That's exactly great point. And so what will happen is, once we can say what's the change, the difference, and like saving lives or whatever that needs to be, then from there, absolutely, what are those key performance indicators, like X number more treatment facilities, X number more of quality care, whatever that is, will be literally right on the dashboard as part of that. I think it's a both and, but I think for today's goal is to first and foremost look at that baseline of what the big problem is and what we can quantify about that big problem. To first set a target on, so that then all those other targets are like, what's going to have the greatest impact, what are the root causes, and the results that we need will be supporting that goal.
I look at it as our target being something different than this, and I'll shut up, but I mean, I think that the target is increased care or triple the number of treatment agencies or something different that is a positive change, then the result will be the number of opioid-related deaths is decreased by a statistically significant margin. I look at it differently.
I think he's trying to say. Positive light.
And I think that the reduction in deaths will be a result of this. I see this as a better target for us.
I'm wondering, go ahead.
I was gonna say maybe they could be framed as like sort of process or intermediary goals. With that, the lives saved being the, North Star high level outcome goal.
So asset-based language versus deficit-based language, right? Because you'll get a different outcome with the different framing of the strategies.
I think Kelly hit the nail on the head. The process goal is exactly what you're talking about.
I'm saying that the target is I'm saying that my suggestion is that our target is not opioid-related deaths. The target is increase the way in which we've treated this disease in our county, and that the results will be a decrease in deaths.
So would you be okay if we change this to the result instead of the target? Because I think it's just a matter of wording. Because I think what we're not trying to say is like, this is the only thing we're going to accomplish. I think what we're trying to say is we have to be accountable for a change that is changing the big results. And I think you're right, this is maybe not the target, it's the result, and just changing the language that this group is trying to accomplish.
I think that's a good point, instead of targets, result.
Yeah, the result, like the difference that's made in the world is that where people are dying, we don't have to like leave with
That's the
that.
result of what
Correct.
accomplished.
Right.
Correct.
More recoveries.
Yeah.
Which means that's not the target.
Correct, we're proposing to change the word target to result.
So
Well, let's hash it out later. I don't want to dominate the conversation. We're gonna
I was
have
just
to land
thinking,
somewhere.
sorry, I was just thinking, is it worded that way because that's what we have to report as a result of receiving these funds?
No, I don't think they're
No.
that married to the
Okay.
words.
And then it has to be measurable, so maybe it's because it has to be measurable, that's something that it's simple to measure?
Well, we have to have something that can be a result, that we're accountable, that really changed the lives, like to show that an actual change in the world was made, that isn't a program, product, or service as the quantifiable it, but it's the actual difference it's made to human lives and to our community. And so that's why maybe this isn't a target, because the target is like, okay, everybody's gonna work to do this, but this is the result that we see. Like at the end of the day, when we say this effort accomplished putting these facilities in place and having more access to healthcare and quality healthcare, or whatever that might be, that result was this. So I kind of think it's maybe just changing the terminology.
Yeah, I think it's a little bit deeper than just changing one word on the screen, but I think my concern, which keeps leading back to what are the actions in the meantime, is the goal is to spend the money as effectively across the range of problems that we have possible. I'm afraid that I'm also having a hard time marrying myself to a number that results in 22 as the top thing. I look at the trend of the growth of usage and the growth of risk and the growth in the speed with which people die with the exposure, and I think, is the 10% reduction even a possibility, or are we really just trying to flatten that curve so it's not growing at that pace? Is a reduction something? I'm not an expert in the arena. I don't know, against the numbers that we've seen, if reducing by 10% or 30% against what's occurring on this point in time, this day, where the next thing that follows fentanyl is immediately behind. I think I would look for a series of targets that are more around, here is the increased number of people we will reach out to with preventative efforts. Here's the increased number of people we will reach out to with treatment efforts. These are the numbers of people we can touch in a way that leads the right direction. I'm not sure that I can see, back to Steve's causation and correlation just as effectively. I don't know that we can magically tie a bunch of KPIs together and have them result in 22 fewer people buying without really wrangling the data for that connection. So I am having a hard time connecting to the pinnacle goal.
I just hear you talking about like the bell curve, right, in coming years, like what has it been over the last 2 years? Right now, if there's 100,000 users for whatever, what's it gonna be next year? Is it gonna be 200,000? In which case, those deaths would quadruple, where reducing it 22 from there does not show any impact to the community at all, but, absolutely.
I thought as a logic model would be helpful. So there are a couple of recommendations I'm hearing. One of the big things I'm hearing is around potentially thinking about, I guess another way to think about this too is what is that North Star ultimate impact, right? And so I think to a lot of your points that have been lifted is there will absolutely need to be targets set around increasing the number of services and programs available and how many community members are being served and how effective those things are. When you think about the ultimate North Star or ultimate impact you hope to make, like, what are some things that come to mind for you? We've got opioid overdose deaths, but when you think about the ultimate impact, is that the ultimate impact, right? And so it sounds like there's a couple options here, right? We could modify this ultimate result or this large scale community result, right? This measure of overall community well-being, knowing that your work is really going to focus around the more programmatic elements, the funding, those increasing the number of services, increasing number of community members are going to be served. It sounds like one option is to potentially flatten the curve. I'm also hearing potentially going back and thinking about a logic model. I guess I'd like to hear from some other voices about this modification that's on the table, knowing that there's also an opportunity to identify those more programmatic targets of how much we need to increase services in order to reach this ultimate impact. Yes.
I know a new voice. We all might regret this, but, I'm kind of going back and forth on increasing services. I mean, I agree that we need to increase services, but we want effective treatment. I mean, how many, we remember the just say no period, and how much money did we actually throw at the just say no programs, and how well did that actually work? I mean, so we would like to see increased services, but we want effective treatment. We want treatments that actually work. We want to increase those treatments, but we don't want to be throwing money at something that the treatments that don't work. So we have to be careful if we're going to be throwing money at increased services, that we are throwing money at something that is actually going to work. Treatment that is actually going to work, and not treatment that is just, we're throwing good money into something that's not going to work. Let's just say no, try the type of program.
Right. Spending the money can't be the measurement.
Exactly, yeah, so we could increase as many services as we possibly want, but if that service isn't going to be effective, then it's not going to do us any good.
So then it's identifying those services that are effective,
Right. So we've got to be able to find those services that are actually effective before we, throw a lot of money into increasing those services. Isn't that a politician answer?
No, it's actually.
No, it's good.
It's effective, I think. One thing that can be considered is what courage it might take for this group to say, let's look at the ultimate impact, and then what are the things that it needs to get that ultimate impact, instead of like, what are the things that we want to see more of so that an impact happens. We flip it and put the needs of like what has to change. And it's hard though, it's really hard. I mean, it's not always usually in terms of
Commissioner Henry, you were saying for it to work, for it to be effective, and I think it's defining that. What does that look like if more services are in this community and they're working? How will you know? What are you looking at to know
that these services by adding them by.
Well, you're looking at what you're providing, so if there's hardly any medical assistant treatment centers in Adams County, well, now you bring two more, or you're funding those.
But is the goal the MAT treatment, or is the goal the impact on?
Well, that's what we have to decide, what's most important, what is really treating addicts right now? Is it the MAT treatment? Is it, inpatient for Medicaid recipients?
I would argue that the goal is that we have more humans who are able to be alive through the epidemic, right? That we're saving lives and actually preventative even. So at the end of the day, like, what is it that the difference that this group can make? Yes, I get it, your charge is to distribute funding, absolutely. You have to have metrics that account for that. So what? So that what? What changes? How are we better off as a result?
Here's the newbie, but I have to say something. So, I mean, we do a lot of this in public health, and we did it in Broomfield, this whole strategic planning, which you guys probably all do all the time. And we're doing this right now with the consortium. But like, our ultimate outcome is to reduce prescription drug misuse. So that's it's similar to decreasing deaths, right? But I mean, this is black and white, but right, like the logic model she's talking about. So this is like reducing drug use, and how are we going to do that? And these are the things you're talking about: medically assisted treatment, all these interventions, and those are the things you're going to want to measure. So we're all saying the same thing.
Yeah, we are. We're just
it's and getting caught up in the 10%, 20%. There has to be something measurable, but this is what you guys want to do.
I think that what we can do is maybe bring that in that format, because we have those that we call a key driver, a logic model, where there's lots of words for it. And I think that might be helpful, because we were able to gather more information today than we had before we walked in the room today, to see like what are you trending towards seeing as practitioners. And folks who are making decisions about this, like what are you seeing as the biggest needs, priorities, et cetera. But when we put the whole picture together, it might be more clear as to like, oh, there might be some numbers here that we can hold ourselves accountable to across the board. That sounds like a good next step?
Yeah, I think so.
Can we get a thumbs up, thumbs sideways, thumbs down? How do folks feel about moving forward in that direction?
With like a key driver logic model that has it all starting. It's going to be like a tapestry that's not as clear yet, right? It's just the different pieces of information, all how do they fit together, and then from there we might be able to pinpoint, support you to like say, gosh, this is a clear opportunity for a metric.
I saw a lot of thumbs up. Any concerns or
other
proposals?
In the future or today?
Well, we'll bring it back like very quickly.
I think that my suggestion for the voting council members is that we should leave here with a target today. To me, pushing this out another month or two and not having a target seems like I mean, unless we schedule a meeting for September, but I think that, I was trying to think about it in terms of something else, like school, like the idea that a child doesn't drop out of school is not something that I want to be the goal. The goal is a child is thriving in school, or the child graduates from high school. And so the death thing, I think, could be a part of it, but to answer the question, I think for me, it's we want thriving members of our community, and maybe this can be one of the metrics, but to answer Commissioner Henry's point, we actually do know what are evidence-based practices from various communities within our own state and nationally and internationally. We actually do know what are evidence-informed practices. So I'm saying I don't think we should leave this meeting without having a target, because to me that pushes our work into November, December, January.
I don't think we even have the option of leaving without some target, so that's what's due in the future. I think what they're talking about, and forgive me if I'm putting words in, is setting up that second tier.
Yes.
Against that target, what are the programs and measurements and things that will support the target that we're developing?
You're saying
You're suggesting we do come up with a target?
I think if you feel
Because I
like,
didn't hear that.
I think if you feel like you can, I'm saying that in order to really address what the larger group is saying they need to see in terms of like goals and targets, we have to have the whole picture. Today was really about like the change, the difference, the result that we can put forth to say this is the direction that the council, like how the council's gonna hold themselves accountable for a different community than community with these opioids. That's really the first level, but too, I would also say to take a level of kind of strain down is it is completely modifiable. They're not asking for concrete things set in stone, like what direction are you heading, what is this starting to shape up as, and as we gain more information and have more conversations, we're able to modify the plan.
So what I'm feeling in terms of the depth measurement being the primary thing is that it sounds too small, it feels too small, and yet it has so many hidden things that it doesn't make sense. So I'm looking for a measurable positive impact on the community in crisis. So an increase in effectiveness of prevention and treatment, as opposed to reducing the death count that I think is going to go up regardless, because the curve is so steep that reducing by 20 is not going to change that curve.
Kelly, what are your thoughts? Oh, sorry.
So I'm hearing what Peter's saying, I'm also hearing, I think what Levon's saying is instead of us identifying dropouts, we're gonna identify graduations. And so, is there a positive that we can look at here? Because it's kind of instead of a flat number of numbers or counts, it could be a proportion like the 100,000. Once again, I'm looking at deaths because I don't know how to identify success. So how do we say, it's easy because you have a milestone. How many graduations do we have, right? It's easy to say how many dropouts we have. Here, it's easy to say how many people died of this cause. What it's harder to say is how many people are not dying of this cause. But in a way, you can kind of inverse it. And so if you do it by a proportion instead of a count, maybe that's kind of an inverse way of showing. We have 995,000, 1,000 people, 995 people out of 1,000 are alive. I would ask the folks in this room, you all came, we started this whole day, reasons why you're here. Going back to those reasons why you're here, how would you measure success? That's what we're all trying to do. I know, but I'm just kind of figuring out, I understand the focus on the negative versus focus on the positive, but laying it on the table, I don't have an answer. I'm just asking you.
Well, I think we should throw those out there, and we should start laying those out. What defines success? What would it look like? I mean, right now, one of what I would define and look at is, more inpatient or Medicaid recipients, more inpatient care. That's huge. That would result in the numbers. So maybe it's a point of throwing that, identifying the 10 things that will really bring results. I think if we would do that, that would help push us to the next level of, well, what's the target then of those 10 things?
And I don't know the answer to that question you're asking either, is how do you measure that? And you're talking about accessibility of care, whether it be inpatient, outpatient, MAT services, whatever it is, you're talking about accessibility of care. And per 100,000 model, like, is how many right now in 2020 or 2022 are accessing opioid SUD treatment, right, per 100,000, and can that number increase by 20% by 2024, which would sort of be evidence-based as far as, okay, treatment was this much more accessible, we have this much more people reaching out and engaging in opioid prevention or SUD treatment of any form, whether it be inpatient, outpatient, but then again, we come back to that bell curve. Did it really increase, or were there just 300,000 more users, but accessibility of care is something that stands out to me as a way to sort of how many people are engaging in the services. I don't know the answer.
Before we did this, there was, in Adams County, there was no inpatient treatment, but after we did this, we funded 2 or 3 or 4 facilities, or there was no, like the gentleman here said, there's no dual diagnosis centers. Okay, so after we did this, we funded 3 dual diagnosis centers, and we don't know if it decreased the overdose deaths by 10% or what it did.
But could
That's
we
what we
count the admissions
into those centers and see what the results are compared with.
More admissions, more of that.
I also think too, if the goal is around treatment, where does that leave, like me who's here to advocate for like prevention education too? Like it would be hard for me to connect with, if the target is increased treatment options, like where does that leave prevention?
Well, it doesn't
Prevention
mean
and
that it's
education.
all part of this, so
Right.
that is just
And I guess
one
I think
piece.
that's where I do connect with more of like the decreased deaths, because I can see how my work would then impact students learning and preventing their deaths.
One of the things that I like about our partnership and what they do is they force us to have these conversations where we don't define our success as busy work. We say, what is the outcome we wish to achieve? Hold us accountable. It's kind of like how, I think you know what why is, but you have to ask that another 2 or 3 times, right? Why is it important to have treatment? Because we can save lives, maybe we can say, and maybe the definition isn't just about, and I was never doing the in person. Maybe it's not just about how to prevent deaths, but also identifying how many lives will we save. Whether it's somebody administering Narcan or somebody successfully completing treatment. It's like the negatives and the destruction of lives that I heard about wasn't always just the result of death. Sometimes it was the destruction of jobs. Sometimes it was the destruction of families. Sometimes it was the ability of, so if we also look at it, it's not just how do we prevent deaths, but how do we prevent the destruction of lives? And we can identify, is there a way to identify prevention? Because if we're only focusing on the Band-Aids at the end, we're gonna have to get a lot more Band-Aids. So.
I do think, just listening kind of anecdotally to some of these conversations and wanting to interject, I think this is about the 5th or 6th ROAC region meeting that I've been to. So it really does expand the full capacity. And so what I would really encourage all of you to do is, figure out kind of maybe that one overarching goal, but then what are your goals in those specific 5 areas to address, so that you are seeing the work that you're doing from a prevention perspective being attainable in there. You may then also want to shift or augment your data dashboard to say, because prevention, we'll just take that one because that's the world I worked in forever, is really hard to track, right? So to be able to say, from a prevention perspective, here was the outcome, that sometimes is 20 years down the line. Right, yeah, exactly. But to be able to say, we've done X number of Narcan trainings with X number of students in schools, that is a preventative measure. We've handed out X number of fentanyl test strips as for populations exiting institutions, whether that's a hospital setting or a jail-based setting. That is something that you can track to be able to say, this is how we're moving the needle and educating our communities in these different areas. That doesn't necessarily need to ladder up to number of deaths. And then I think it goes back to your question and comment earlier about how do we know what we're doing is specifically impacting. The reality is there's so many figures, factors that roll into this. We don't know exactly, but at least then we can have an account to be able to say, here's all the different aspects and avenues that we've taken to address that and impact change. I would say in some of our more rural communities, they have a much higher focus on prevention than they do treatment and recovery. Primarily with the thought that if we can prevent more people from needing treatment and recovery, then maybe we somehow start to address the deficit in treatment, and recovery supports that we have. So just some thoughts to think about from other regions that have tackled some of this work too.
I'm looking for quality of life measurements more than end of life measurements.
I love that. And so, as you know, we have the data that we have available to us, CPPHE, and the one that we can most identify that tells us that the life is better is for them to be alive in the opioid epidemic. So love to see what can that positive be. I love the recommendation that you have. Put that back out to the group of like flipping it, instead of it being how many lives were saved, or were like how many reducing deaths, increasing the amount of lives kept intact.
And that's the thing too, is we have what we have to work with from a data standpoint.
So I think. It could be reduced hospital visits, correct? Reduced referrals to human services?
So the thing is that sometimes those are life-saving things, and you might want to see an increase in hospital visits or an increase in referrals to human services, because those are outreaches for health.
I was just gonna say, what about, one data point that we collect is, we do a lot of prevention, is the Narcan, the reversals. So, I mean, counting those as lives saved, I mean, which we see quite a few. So I think that's one way to kind of merge those two. Yeah, prevention.
And some of those are lives saved today, but is that still one of the deaths in the next year? So it's a struggle to deal with. And in the absence of I'm not seeing consensus around something else, and I'm sensing some pretty significant pressure around reduction in deaths. So I don't know what next you have in the conversation.
I'm hearing a couple things that have been bubbling up to the top, and I'm wondering if there's a way to marry them. So a couple of the big things that you all have lifted: flattening the curve, asset framing so that we're focused on lives saved as that ultimate impact, and that ultimately at the end of the day, this is about ensuring thriving members of the community. I'd like to propose to you all setting a target around slowing the growth rate of, or slowing the increase in overdose opioid deaths, so that there is an increase in the number of lives saved and kept intact. So that community members have a thing to thrive.
Well, for me, it's talking, again, just going back to deaths, right?
Mm-hmm.
And that we just want to make sure that's surviving. That's not thriving. And that's one of the things that, if we're going to thrive, how successful are we on our treatment for them to get recovery, right? So prevention and everything else, I think that's very important. Again, there's people out there that every day we come in contact, but I disagree with thriving members is making sure they have Narcan and they can get, to their next high. So to me, it's like, how quick can we get them into some type of treatment, and how successful is that treatment? And then having it spread out for prevention, looking over the next 15, 20 years, to try to reduce this epidemic that we're going through. In 2 years, I can tell you is what I've been seeing, that number is going. And with the fentanyl and some of the other things that we're up against, I don't see that number reducing in 2023. It's probably going to double. And so how fast can we move to get into that space? Maybe 2024, but this is years of what we're seeing on the street day to day. Again, it's that's my only thing. It's like, I just didn't like the word thriving, because they're not. So how can we put some things in place?
So I think it comes down, I think you have a window that's coming to slowing the growth. I'm not sure that we have it with $1 million and a year, or $3 million in the next 2 years, the ability to not only eliminate the growth, but also reduce in exactly that time frame. So I hope to see a goal that is targeted on reducing that growth through all of those mechanisms that are prevention and treatment and care.
What if you extend your target? It doesn't have to be 2 years. This group is gonna be around for 18 years, we're gonna be getting litigation settlement dollars, and we're looking for other funding sources to break with this and coordinate with other regions. So yeah, I mean, the state's asking for a 2-year target, but if you wanna think bigger than that, I don't think it has to be tied to 2 years.
And also remember, everybody, this is from the administrative side. We're not getting a lot of money every single year. So it's not like we're getting $21 million a year. I mean, yeah, great, $2 million this year, but I could give your organization $2 million, and by 4 o'clock today, you could spend that $2 million. And needs and services, Glenn and I were talking, I could give $2 million to human services right now, and they could spend it probably by like 3:15. So just remember that it's not, yeah, it's $2 million great this year, maybe $1.5 next year, maybe we get more. We don't know what the courts are going to do, but we do have 18 years, 20 years to figure this out, and maybe the groundwork we lay now will continue this work past the 20 years, but $1 million a year, maybe a little bit more than that, it's not gonna go very far with 5 service areas. I mean, I'm not great at math, but $1 million spread over 5 service areas, you're not gonna have a lot of money. So just remember that in context, that again, we're not fighting the war on drugs. You know, we're addressing the opioid crisis. We're addressing an issue in our community. We're not gonna fight something. We just have to figure out how we want to address it.
So maybe we can triage a little bit, right? So looking at it where, what's immediate? We're seeing a lot of stuff out there. What's helping? The Narcan, the fentanyl strips. How can we get that out to the community? How can we get them using it? How can we reduce on that aspect of it first? And then we build in the other programs and everything else for the, making sure they have, that counseling and that, afterwards, and then maybe move into something, again, with the prevention, or it's longer term, really trying to get people to realize, especially our kids, realizing that it's not really.
What is the target and requirement in terms of measurability of this target goal? Does it have to be a hard number with a hard deadline associated with it, or can it be directional?
The fun thing about the AG's office is that they're giving a lot of not leeway, but you kind of tell us. So good and also challenging, because we don't have super strict. But when Commissioner.
This is also a great opportunity to start talking regionally and start having counties and cities putting money in and start working on the issue regionally. Because this is really a great opportunity where we can start having, because obviously we're now starting to have the conversation regionally.
And actually, well, that's what I was gonna say earlier, and then I'm gonna
Yeah.
bring it back to you, Chief May, is that Gabe has a really good point. This is not a lot of money, what we have so far. But what I alluded to earlier is that this group has the opportunity to not just decide what happens with this money, but let's find other sources of money, including, and maybe especially, other public dollars that can come into this region. And also even looking at the federal level, I think that there's a national network that you have behind you within the Strive Together network, within statewide with the other regional councils, that if there are things that can be advocated for, that the opportunity of this group is to impact so much more change in addition to these dollars. And I lost my train of thought. There was another piece that I was gonna say, but I think that the bigger picture continues to be, ultimately, what are you running towards? Not just for these dollars, right? What is that big impact? Chief May?
I think that, exactly right. One thing we're missing in this county is detox centers, they just kick them out the door, it doesn't help, right? So we have an opportunity after they detox to get into some type of treatment. And I can tell you, maybe provide something else again, and having them continue training, or again, on that positive stuff. I had to fry my youngest one. I was like, hey, if you don't do this or this, smoking or drugs at the end of your school year, you graduate with $2,000. I don't know what it looks like. It worked for him. I don't know if it worked for other people, but again, some of those things that make it more, hey, a positive reinforcement. Hey, at the end of this thing, we're going to provide this for you, right? Because they're costing us, costing society a lot more money. We see the numbers. So why, what can we do to help them get that next leg up? So that's one of the things that I see, but I think we're talking too much of.
Yeah, it would be great to be able to have JD 17, which includes Broomfield County, Adams County, which includes all our municipalities, could chip in and be able to provide a detox center would be absolutely wonderful. I think so. You've got a couple of municipal guys. There's few people here that could, help out. Yeah. Thornton, I heard, had a lot of money. I heard they're like really rich.
I think the leader that we could take is we don't have to determine the strategy today. The outcome for today is not to determine how we're gonna solve the problem. The real big outcome today was, what is the measurement that's gonna tell us that the problem is getting solved?
And I just got a confirmation from Heidi that there isn't actually a number and date requirement associated with this. So if we give a statement that we want to increase the quality of life for and reduce deaths associated with it, that is sufficient for this goal. We don't have to say we're going to reduce by 10%. We don't have to say we're going to build X number of X facilities or treat X number of people. So this is directional, this is aspirational, but not a hard measurement against against which we're committing ourselves for the next 18 years.
And that's what I was gonna say. I mean, we go up, if we look at, we look at our goals, treatment and recovery, we increased treatment and recovery. By intervention, we increased intervention or prevention programs, we increased those things. I think those are all measurable.
Put that statement into a motion.
Yeah.
I would understand a motion.
Yeah.
So we're not in a formal meeting for a motion.
I agree, but I'd like to hear it as such.
Okay. I'm trying to think of the statement to make for the aspiration, but I think that our high level target is around reducing the impact of the opioid crisis in our area and increasing prevention, emergency response, and treatment methods to lessen the impact.
Can we just,
yeah.
we just carry on what the AG has already kind of put out as measures? So don't they already have like treatment and recovery, prevention? I thought there was some kind of big buckets already that were defined. We just kind of take each one of those as measurable goals for the communities that, I think it is hard to have like just one target other than health.
They have buckets for activities. They don't necessarily have measurable thresholds within those.
I mean, the 5 areas of focus are what's coming next anyway, so that was the idea of target setting was getting us a direction. How do we want to prioritize? What's feeding the prioritization of the allocation of the funds? If we're going to do 20% towards prevention and 10% towards emergency response and 20% towards treatment, and this is the ways that we can divide this up that lead toward that larger goal. So in that regard, recommend partnership idea. First at that top, we want fewer people to die of this, and I want more people to have a higher quality of life. But these are the ways that we can divide up that funding. And yes, the AG's office has things that they're measuring against all of these. We don't have to reinvent that wheel by any stretch.
There's actually a blueprint that's out there that actually walks you through all of the different programs that you can put into place in each of these areas that the state and the AG's office have identified that can give you ideas and help you kind of pick and choose within those buckets of what you want to prioritize for Adams County for the next 2 years. And remember too, that what we're talking about is 2 years. So we have the ability to change that, if it's not working. If we say, hey, we really want to prioritize X, and we find 2 years from now that really hasn't done anything or moved the needle, then we shift. But also be thinking what maybe those long-term goals are for the 18 years. And how we want to move the needle over those 18 years, and then how do we break it down into 2 years?
And I don't want us to get stuck on trying to identify the pinnacle. We've got this afternoon, and we've got several things that really do come literally out of this. So identifying the headline and identifying how to market and present all of this and take a look at more time. And directionally, we know where we want to go.
I just did walking back around this. And each one of those stats was kind of an outcome. Over in that corner up there, we had the naloxone administration of naloxone. That was an impact. Another thing we had over here were deaths. And then we had deaths as they impact economics. And then we had displacements as it impacts of people, kids, right? Being taken from their families. Then we had hospitalizations. I think, even if we identify some of the numbers that we looked at today, then we know it's being measured. We might be able to come up with some specific goals related to the numbers that were presented to us today. And we're not having to.
And that's not an obligation to us. So we know at least that 5 category things to be measured and which direction we want each of them
question.
Yeah.
Will this group, the larger group, or even the smaller group at some point be involved in legislation change at some point? At the state level?
The answer is yes. That's what you have the opportunity to do.
Difference in how we sentence people and, that kind of policy probably needs to be looked at, because that'll make a big difference as well. And I haven't heard any of that really. There was a section where I think that might need to be part of the equation at some point.
Yeah, and that's part of the timeline or the roadmap. I think identifying what it is where this group wants to run towards ultimately, and then how you want to get there, how these dollars are going to be invested in those things. And then, okay, great, now we have decided how this, $2 million this year is going to be spent. We know that's not enough. So what else can we look at? What policy can we look at in addition to that? Absolutely.
So it sounds, Peter, that you have a recommendation for the group to consider around setting a, maybe not quantifiable, but direction for the goal of what this.
What is the aspiration of what we're trying to do, and then build something equivalent to that logic model that this group just shared. What does that mean for prevention? What does that mean for treatment? What does that mean for emergency response? What does that mean for criminal response? What does that mean for hospital program, et cetera?
Okay.
Thoughts from there?
My biggest thought right at the moment is we're now to 33 minutes of scheduled meeting left and 2 hours of content left. So what do we need to accomplish, and how do we move around to getting that done?
Yeah, absolutely. So I think that Rocky Mountain Partnership Team has some really clear actions that we can bring back to this group. That logic model or key driver, whatever you want to call it, that ladders up to that, we'll call it a results statement that you've put forth, Peter, and bring that back to the group. I think that it would also be, if you're open to it, coming back together in September with that more robust data to dig into it. The thing that's due by September 15th are the percent allocations, and yes, they can change, but in order to give out dollars, that has to be turned into the AG's office. I also just want to offer to this group to think about, I know that there's a huge sense of urgency in getting dollars out to the community, we need them, and consider how to do the heavy lift on the front end so that those dollars are laddered up to something that's actually going to have an impact. And so there is a lot of flexibility and a lot of support even from the AG's office to be, what does this region need to be successful? And if that's a little bit more time to understand what those things are, we don't want to put dollars to things that are ineffective, to Commissioner Henry's point. If you are all willing to do it, our team is willing to support you to get there, to have that robust understanding.
Can I make a modification to what you just recommended? My recommendation is, because you are right, like we don't want to wait another 2 months to have all this information, or 3 months or whatever. We put forward the result statement that you're proposing, Peter, which I think really does a good job of capturing the sentiments and thoughts in the room. And then quickly come back with the 5 priority areas with the data points that show the baselines of what's happening there, so that you all can identify this is the sub-target for each of those areas, or the goals or targets for each of those areas. We would be happy to convene you all before that September 15th date, although that isn't necessary, but we could.
Well, I guess if what we're looking at right now is an initial assessment against 5 areas of a percentage allocation, do we have the information in the group of where we want to prioritize? Would you pull those back up?
And we do have an activity we can do to take the temperature of that, what the room is thinking about those allocations, if that's helpful to do now.
Well, I guess I'd ask that question is if you look at these 5, treatment and recovery, intervention, criminal justice, prevention and education, harm reduction, I think our advising people in the room probably each come from one of those areas, and probably would like very much to see 80% of this go into each of those areas, and we won't have
Yeah, they're on
400%. Right, yes, we won't have 40%, 400% to do that. So I guess for those of us who are not coming from each of those areas, some ideas of what would that mean and what would be done with that funding in order to try to figure it out. Because again, as we're reminded, it's $1 million a year. This is not earth-shattering and unimaginable amounts of money. Steve has agreed to match that personally match that piece to increase it. But I mean, I don't want to do a really silly 5 areas and each gets 20% of the funding that comes out of this, because I don't know that would mean anything. That would, it can change, and it's not something that we would commit to from now and for all time. But in September, we need to give an indication of what our thoughts are. So I guess I would be interested in hearing from the areas, what are you hoping to get out of this, and what are you thinking you would be able to do as a result of it?
Did we do that?
We have a ranking.
Have you done an exercise to lead us there?
Yeah, we have a ranking tool that can tell us kind of what the room is kind of,
But
temperatures
yes.
and where you're prioritizing and what order.
So if you pull out your phone and use this QR code, it'll take you to Menti. I'm gonna pull up the results in a second and give you a chance to see them come in real time. I'll wait until everybody has it.
Oh, no. Scan the QR code.
You're walking QR code.
Did it come up on your phone, Glenn? It did? So you get to rank them, right? Okay, great.
Where's the one for administration?
I'll just say too, if you also have like a couple of top priorities, but don't necessarily want to rank them all, that's also an option as well.
Looks like everybody has the QR code, so I'm gonna go ahead and open it.
Y'all are fast.
Is this right, Ashley?
Yeah.
Do you need the QR code?
Yeah, that's correct.
Jody, can you help with the QR code one more time?
Yes, I can. Hold on. Here you go.
Oh, no, at the restaurant.
They don't pick up on that as much, or having to say that.
Oh,
there you go. For sure, yeah, throw that out the door.
And you can pick up both and move them if you didn't do it the way you wanted to.
Yeah, I
Does everybody have it? Nope, not yet. So we have 16 people have.
Is this your real time?
This is real time. 16 people have participated.
Cool. I know, it's right in line right now, Joe. Like, you know, probably better. Vegetables and protein. Yeah. What would I want? Probably better for me. How is the emotion defined with this? Is that like first responders? Or is it?
I just see a show of hands. Is anybody still putting in results? Everybody, oh, taking a picture? Good.
Interesting, yeah. I mean, diversion is also. Again, also criminal justice, so I'm not where the line is.
I think we're at 18 right now.
I'm gonna go around with a laptop.
Laptop support to whoever might also hasn't had a chance to vote yet, or like, ranking?
Yep, absolutely. Is anybody, can we just maybe see hands if you haven't yet been able to rank and you would like to? Ashley will come to you with the laptop.
Anybody like to rank? I've got it all set up. Everybody's,
Feels like we've got.
I think we're good. Great. Okay. So here are the results. Treatment and recovery, which includes detox, prevention and education, intervention, harm reduction, criminal justice, and then other.
So what does education include?
Prevention and educate, what does this one include?
Yeah, what is education considered around?
so it could be things like education about the impact of opioids, what types of services exist.
Also alerts potentially from law enforcement when they're aware that something might be coming out to the streets that's been laced, to be able to be a warning, like be extra careful, those types of things.
I can actually give you a list on here. Sorry.
Okay, so I'd have to say that watching that, I'm surprised not in the
There you
least,
go.
given the people who were in the room, where it came out. So, I don't know that it gives us the most important things to fund. I don't think there's anything up there that anyone would say, oh no, God, we're not giving the police a dime. So I don't think that was the effect of that being the lowest, but is the intent of that to take those things that have the highest priority and assume that equates to the highest percentage allocation?
No,
Or
it's
was
really
this-
just a temperature check on what everyone is seeing based on the data and who's in the room, really to see where there are gaps in information, like who's missing from the table.
I just have a question. Does everybody in the room feel really grounded in what's included in each one of those buckets to be able to make that decision? Because I feel like there's some questions about like what
is that area?
Yeah, or what would potentially, what programming would potentially fall under each area, so it may be good, maybe not today, but at a future meeting, to define those buckets a little bit more for people in the room and then take another temperature check.
Because we would need to know what does that mean to allocate it. Perhaps a $25,000 program in one area might have a really significant impact, but we don't know what that is.
That too.
Versus throwing all of the money in another program might really be important and do something day to day, but not have a measurable impact on the whole the situation or leave things blind. So I
And
was
then
very
similarly
curious.
too, like, does naloxone and fentanyl test strip distribution fall under prevention, intervention, harm reduction? You know, lead co-responder, is that intervention, is that criminal justice? So I think maybe just providing some definition to those categories might even help.
Jody, do you want to answer that?
Formalize things.
Well, I wanted to give Commissioner.
I think that what you just said is so important because we haven't had our deliberations, discussions, and education about what exists. We haven't done our asset inventory. I think today might be a good baseline to say, you guys remember on August 12th, you guys all thought this is what was most important. Now that we've analyzed and shown what each category and subcategory and where all these things fit and all the buckets and all, and we identified the holes that exist in our community, we could do the same exact question in a month or two and say, oh wow, we realize, and then you're kind of coming together as a team. So I look at this as like so I agree with Peter's, I think, I'm interpreting Peter's concern as, wait, are we jumping way ahead and making this dispositive of how we're gonna distribute the money? I would say, I hope not, because then the follow-up question was, have we done enough to analyze the dive? And I would say no also. So this could be a good baseline. And it will actually be pretty interesting once we start doing those discussions, some of that education of ourselves, and identifying the holes that need to be filled, how we've come together and really done an educated decision on where we prioritize our money.
Jody, do you want to talk about what the timeline or slate that you have for that question, and then maybe we administer it again?
Yeah, so originally we were thinking that this group might come up with a draft recommendation of allocations to put out to the larger community. We're not gonna do that today. What we have done on the back end is I'll call it the beginnings. I feel like it is robust, I do believe that, and I am also sure that you all can identify additional programs and things that needs to be on here. But we have begun to do that asset inventory to understand who is doing what work in this region. And kind of summarized what we're finding from that. So I just want to call out that on this dashboard, you'll be able to see different visualizations of who are the stakeholders doing work in Adams County. How many of them are, we'll just say prevention and education, for example. There's a few. A robust program and resources bank for each of those entities. What programs do they provide? And then looking at them on a map of Adams County, what does it look like across the region? So Commissioner, absolutely, sorry, while it's loading, I think that the next step definitely needs to be a deeper dive into all of this so that everyone can understand the landscape across those 5 priority areas. I also want to remind the group that you don't have to allocate dollars to all of them right away, and you can change your mind. And so proposal in the timeline, Liz, you had asked, I'm gonna come back here, would be to reconvene in early September sometime for our team to bring forth not only that logic model key driver with all of the information that you've shared today, maybe even answering some of those additional data questions, and then also doing that deep dive into the asset inventory that we've already done. I can also commit to ahead of that is connecting with everybody here, if I haven't already, because a lot of you have already helped inform this, to make sure that it is the most robust version of understanding those assets when we come together next, so that then the decision really could be made in that meeting on the allocation percentages, again, knowing that they can be modified if you decide to.
And this from the county's perspective, we could always go back to Heidi in the state and request that, hey, September 15th really doesn't work for us. The regional council is requesting an extension for that 2-year plan because we want to make sure we get it right. We want to make sure everybody here, and especially the voting members, they're all good on the plan moving forward and everybody's, good on moving forward. So it does say September 15th up there, but we can also make some phone calls and see on our end at the county end to say, look, we just need a little bit more time so the council has a better chance to get together, meet in person, flush some of these things out, and make sure we make educated decisions and educated recommendations.
And we can submit our draft without having a percentage allocation as well.
I got a heads up that other regions are already asking for extensions, so you wouldn't be
So we can send something for that date without making a commitment. What they need is a commitment by the time they actually cut a check.
Yes.
Correct.
So there's all kinds of opportunity to reframe that.
And that would be much better from the county's perspective, that we have a good plan in place and allocation so that the council knows, but then from the administration, from the county's perspective, we know what kind of contracts we're doing and the money going out. So it's more on the administration side, so we're ready to go to help.
So clear recommendation then is we need to get a time on the calendar for early September to come together to do that deep dive of not only the key driver, but the asset map. Huh?
Can you speak up?
Oh, yep, sorry. Come back, we'll need to schedule time, it's not on the calendar yet, to come back in early September in person for anybody who'd like to be part of that conversation to do that deeper dive into the asset inventory and walk out of that meeting with a more well-informed decision on allocation percentages.
Can we break up into small groups to do that? And so we have 5 areas, and each group will take a particular area and divide and conquer, so to speak, to do that deep dive into the asset inventory.
Yeah, I'd love to see report outs on the 5 back into the voting council as opposed to trying to dig deep into all 5 of them. And if that was happening by the end of September, so in early September, you're doing that piece, and then coming back in September along with your TBD date for us to get that readout, I think that might make sense.
So report out in early September, later in September for a decision? Is that what you're saying, Peter?
I'm saying collect the information earlier in September, collect the full amount of Rocky Mountain Partnership arrangement, but get the right stakeholders in each of those 5 areas.
Yep.
So you may need 5 different meetings to accomplish that.
Gotcha.
And then a readout from those 5 back to the council.
Okay. I see a lot of nodding. Is anybody opposed to that recommendation?
Is that necessary? I thought you guys had done most of those deep dives in terms of the asset map. Unless I misunderstood what your recommendation was.
Well, what we have, sorry, wrong one. We have done some asset mapping, but I think what Councilmember Padilla is asking for is a more robust report out from content experts and providers within each of those areas to better understand.
And mostly not just what do you do today, but what would you do differently and what is the ask, what would come from this additional set of funding? I can read the website if all I need to know is what things exist today. But what would change as a result of this funding? I don't know. What will you do if there's another $500,000 for prevention or treatment? What will you do if there's something else?
What if we were to administer a survey to these providers and just ask them those questions? Just get like hey, what's working, what's not
That would be
working?
fine. You can do
What
it
are the
by
barriers
time,
and
you don't need to
challenges
meet,
you have?
that's perfectly fine.
And then we can just put that into a summary and have that ready. And to your point, Yvonne, maybe save some time too, instead of having to do that all via meetings and whatnot, and then bring it to you sooner.
I'm able to understand what you do today. I wanna know
Yeah.
what would
So what would you do different? Like,
We're trying to identify gaps. That's
Yeah,
how we
strengths and
identify
gaps.
and
What's
then we can-
missing?
And then we can fund those gaps.
Yep.
With the dollars.
Yep, okay. That we can do. Here's what I'd like to propose is in the post-session packet that you all get, we'll start to maybe put together 2 to 3 top 5 questions that would go out to these very, very busy providers. But we'll make it so that you can get feedback back on what's being asked, so that we can make sure we're doing a good pool of information. And then we'll also include a link to the spreadsheet of who are the providers that would be receiving it. And if you're like, gosh, so-and-so's missing, please let us know, and we'll make sure we add them. We'll do the outreach to them necessary. Does that sound like a good, tangible action commitment to help move the allocation forward? Yeah, we have a couple questions. Jody?
Yep.
I just want to make a comment. And I hear everybody maybe trying to boil the ocean. And I just want to put this out here that we've got 2 years. And just sort of maybe to frame it with having some target for 2 years that can be actionable and achievable. And we've got the 18 years to get into some of the real pieces. Sometimes I feel groups get into this inertia because we're trying to get to a place where we're boiling the ocean. I just want to put that out there. I think we need to address a crisis, an immediate crisis. If I'm talking a pie in the sky goal, I'm going to say that we don't even have a continuum of care that exists for all people to access care, regardless of payer. And there's a lot of things that we're talking about here that we're not going to be able to get action on because they're policy, huge policy, systems level change. So as what we're doing here today aligns with what we can do on a system level policy change, and I think we can move the needle. I'm thinking, I don't even know if the treatment exists yet. I can tell you from a provider perspective, we don't even have the workforce. We're not even getting people applying to the positions for treatment to move the needle. So I just want to share this from an outcome standpoint that we spent a lot of time trying to drill down to one goal. but really we want to be actionable, we want to be engaged, and we want to be able to do something that we can actually accomplish, and we have the control here within 2 years to do.
I think to that end, this information isn't gonna be a commitment that resources will go to these things. I think this information will help inform the voting council as to where are the opportunities, and maybe it's one specific strategy or action, and that's as a result to your point, because you're right. It's gotta have a result and be something that can be accomplished with the dollars to start with.
Was there another question that I missed over here?
I think that if we could really see, and I know thumbs up is tricky, is do we see if there are any thumbs down to that action commitment and pulling just more information about what those who are not in the room have to say about what are gaps and needs for us to pull that information and bring it back to this group to then pick up the conversation as to where can we actually have big change in a short amount of time. That, can I see if there's any thumbs down? Well, if you're in agreement with that, no need to even put your hand up. Okay. The second area that we need to address, and we do have a little bit of action to get to and we're running out of time, is the question of the, and again, I'll own, the word isn't, I don't think that the right word is target, even though that's what they call it in the
two-year plan
document. In fact, I wouldn't even call that document a plan. It's really like a report of what the group is gonna focus on.
The result
Potentially. I think, could we pick up real quick where you were here with your recommendation
I think we did enough on that basis today.
Okay, so we're good with that language, but we're not gonna put it forward.
We'll put it back in front of people as it's proposed, but we've got opportunities before that date comes for people to look at a solid sentence and decide if that fits or not.
And then I do know Ashley was building on what you were saying, Councilman. Ashley, do you wanna share what you were thinking as a potential build on?
Yeah, so building on what you were saying, I think that the major things that were lifted that it seemed most folks agreed on is that the ultimate impact is like about saving lives and increasing the quality and well-being for community members. And that in order to do that, there's gonna be work happening in each of those 5 priority areas. So my recommendation, my recommendation for your results statement is something like flatten the curve for opioid deaths so in order to save lives and increase the quality of life for community members by increasing prevention, increasing intervention, like what that looks like. How is that vibing with folks?
I think we can wordsmith.
Yeah.
It feels good enough to put in writing and then bring before the council.
We'll put it in writing in the post-session packet. We can also get input between now and the next meeting, and bring even a more thoroughly vetted result statement in addition to the additional information we already talked about. Okay?
Any thumbs down? Okay.
Questions? Okay. So in the interest of time, and I want to get you out on time, there's actually only one critical structure and governance item that we need to do in this meeting that we can't do outside of that meeting, and that is confirming the chair and vice chair of voting members. We put out nominations, and there was actually one nomination for each of those seats, and both of these folks have accepted the nomination. So for the voting members who are still with us today, I would like to see, I don't even need to use your paddles unless you really want to. I know we gave them to you.
I feel like we accomplished something.
We'll start with the chair. So Councilmember Padilla from City of Franklin. The 4 chair has accepted this nomination. Does everybody endorse this nomination?
Move to approve.
Anybody
Peter,
opposed?
as our chair.
Hi. And Dr. Kelly Weidenbach as vice chair.
So moved.
Fantastic, thank you. We will be working with you, Peter and Kelly, very closely. I know Kelly had to hop out for another meeting as we move forward with this.
Jody, if we are required to take minutes, we need to make sure that every voting council member has agreed.
So we'll say unanimously.
Yeah.
We had a forum still in attendance.
Yep, we did have a forum.
Right. We do have a post-session survey that we would really, really appreciate feedback on so that we can continue to improve these types of meetings moving forward. So I will humbly request that you use this as your exit ticket. I apologize for any challenges with the QR code. We'll put that back up. As the next step, I will be working with our voting members around that early September date. I won't make you get out your calendars and do that right now, especially because we know we've lost some folks. But we will get that on the calendar as soon as possible. And in fact, I'll work to put that in the post-meeting synthesis for you early next week.
Yo.
And if you're not a fan of SurveyMonkey, I'm gonna put a flip chart back there with what went well, what would you improve, and you can throw a sticky note on there or write directly on it. All the options.
I'm going to end this live stream before anyone.